Good morning, everyone. My name is State Senator Gustavo Rivera, Chair of the Health Committee, representing the 33rd District from the Boogie Down Bronx, like you could not tell. Welcome this morning. We are doing a hearing, an incredibly important hearing on prevention of childhood lead poisoning. I am joined by many of my colleagues, who I'll introduce in a second. It has been, as the chair of the Health Committee for the last 3 years and member of the Senate for the last 11, as if I need to remind myself that I've been here this friggin' long, this has been a persistent issue. It is something that I'm glad that we're having this conversation today, because it is not something that has been resolved. As we will hear from many folks all across the state, there is still an issue with the presence of lead in our systems, which means that we still have kids getting sick, and we still are responsible for making sure that we clean it. But I know that there's all sorts of difficulties involved in that, but we want to make sure that we have a thorough discussion where we invite all stakeholders to make sure that we really consider all the options, because ultimately we want all of our people to be healthy. We want all of our children to be safe, and the conversations that we have today and that we will have in the legislative session next year, hopefully by some of the products of what happens today, will help us to be able to achieve that. One quick note before I pass it over to my co-chair and introduce my colleagues and we get rolling. We are quite, as you can tell by my mask, we are still in the middle of a global pandemic. We are very glad to have the vaccine. I am House Moderna myself, hoping everybody has received their shot. But just for the sake of safety, I would ask that all of unless you are eating or drinking for a very short period of time, please keep your mask on, even while you are doing your testimony. It'll make it a little bit harder to understand at times, but for the sake of safety, I believe that it is more than worth it. So I will pass it over to my co-chair and then introduce my colleagues before we get rolling. And my co-chair is Senator Brian Cavanaugh.
Thank you very much. I would like to say I usually think of my colleague as of the House of Gucci, but the House of Moderna, that is a new one. And I share his sentiments about continuing ensuring public safety during this hearing, which is, after all, about a very different threat to public safety than the COVID virus. It is, as my colleague mentioned, a critical time to be reviewing the state's approach to lead poisoning. Lead, we know, is an extremely toxic substance. We've actually known for hundreds of years that lead was very toxic, and notwithstanding that, we continued to permit this toxic substance to be part of our everyday lives for many years, including adding new infrastructure and new lead to the environment. We didn't ban, nationwide didn't ban lead in new housing until the 1980s. We didn't ban lead in gasoline, which pumped it out of the tailpipe of most cars in America, until 1992. Unfortunately, although we took steps to eliminate new lead being added to our environment through paint and other sources, we have not done the work necessary to rid our environment of this toxin. Lead is considered one of the most common preventable environmental health threats in our country and throughout New York State. So, I'm very particularly pleased we're doing this jointly. This is both a health issue that has been overseen for many years by the Health Department and the Health Committee in our House, but also very much a housing issue, because much of the exposure of lead, especially exposure of young children who are particularly susceptible, does happen in the home, not surprisingly, because that's where young children especially, spend much of their time. Through paint and water and other avenues, kids are routinely exposed in our state to this toxin, which has there's no real acceptable level of exposure. basically virtually any amount of lead exposure, as I'm sure we'll hear during today's testimony, poses a health risk. There has been some good news recently. I was proud to join Senator Chuck Schumer, the U.S. Senator Chuck Schumer, in announcing the inclusion of $15 billion over the next 5 years to replace lead pipes throughout the state. That is as part of the bipartisan infrastructure bill that passed recently, and it is a huge step forward. We know that the water system itself is typically free of lead, the reservoirs and many of the mains, but the pipes leading into people's homes, and in some cases the pipes within people's buildings, are still contaminated with lead and contaminating the water. We also need to continue to focus on, at the federal level, on the next round of the ambitious federal funding plan, the Build Back Better Act, which, as currently conceived, includes housing investments of about $150 billion, including money for the Housing Trust Fund Corporation and the HOME program, which do lead remediation work. And of course, we also know that lead in public housing has been a significant threat, particularly in New York City. And again, as currently crafted, that bill would contain many billions of dollars for improvement in the quality of people's homes in public housing. So we look forward to testimony on those matters, on how we can effectively roll out that money, and also on the state's existing programs that have been intended to prevent lead poisoning for a long time, but in many ways have not yet done the job. With that, I will turn the mic back over to my colleague here. I think we'll introduce our other colleagues.
Yes, thank you, Senator Kavanaugh. From my right to my left, certainly just direction-wise and no other way, we're joined by Senator Myrie, Senator Mannion, Senator Ryan, Senator May, Senator Brisport, Senator Martucci. Thank you, Senator Martucci. And hopefully very soon, and I'll just take a second, even though she is not here yet, the first official act of Senator Cordell Clear, who will be sworn in just today. And we, under normal circumstances, the members here are members of the respective committees, and she will be sworn in as a senator, not yet member of any committee, but based on her past experience and expertise in this field, we wanted to make sure that she was here as a senator, so she will be participating in the rest of the hearing as soon as she arrives. All right, so we'll get it popping with the panel number one, New York State Department of Health Center of Environmental Health. That will be Dr. Gary Ginsberg and Dr. Roger Sokol. Please join us. I will also remind everyone that we have your testimony. So although you can try to do some, like the 80s Micro Machine guy, remember the 80s Micro Machine guy? You can do that if you'd like and read your testimony. We can also have you just speak about the most important parts of your testimony, and I'll remind everyone that they will have 3 minutes each. Go ahead, sir.
I appreciate that. We do have a shortened version of what you have in front of you to highlight the most important points. So good morning, Senator Rivera, Senator Kavanaugh, and committee members. I am Gary Ginsberg. I direct the Center for Environmental Health within New York State DOH. Childhood exposure to lead continues to be an important public health concern affecting children's ability to learn and develop. National and New York State statistics show that progress has been made over the last decade as the overall incidence of childhood lead poisoning has steadily declined from 71 per 1,000 children to 39 per 1,000 children in that time in New York State. However, there are still over 8,000 children in the state with a blood lead level above 5 micrograms per deciliter. The experience in New York State, our experience with it, supports the CDC's finding that lead-based paint in older, poorly maintained buildings remains the most common source of childhood lead poisoning. The Department of Health has several programs designed to manage cases of elevated childhood blood lead levels and to address their root cause. and I'll briefly walk through those. The Lead Poisoning Prevention Program provides funding to 56 counties and New York City to ensure that children are tested at ages 1 and 2 by their healthcare providers, and that cases of elevated blood lead are identified and managed to lower the child's blood lead level. The Childhood Lead Poisoning Prevention Program, or CLIP, is the largest housing-focused primary prevention program in the country. DOH funds local health departments to control lead hazards in high-risk housing. Funding targets communities with the greatest burden of lead-poisoned children. And our Healthy Neighborhoods program aims to reduce the housing-related illness in a variety of holistic measures. Our Healthy Homes, through a Healthy Homes approach, and includes the identification of lead paint hazards in targeted high-risk neighborhoods. With respect to lead in drinking water, DOH enforces lead in drinking water regulations, ensuring public water supplies collect samples, operate corrosion controls, and notify the public when the lead action level is exceeded. We continue to lead the country with our lead service line replacement program that funds the removal of lead water service lines in communities with the greatest burden of elevated blood lead, and that we've been a couple of years ahead of the infrastructure, $15 billion that was just mentioned, that we hope to come our way to further improve that program. And all New York State schools are required to test their drinking water for lead. Any fixtures found above a target level of 15 micrograms per liter or parts per billion must be taken out of service and remediated. And finally, New York State offers free lead tests to residents through a $1.5 million fund for that purpose. And a little bit about our partnerships. New York State's childhood lead poisoning prevention programs are administered with the advice and input from the New York State Lead Poisoning Prevention Advisory Council. The department also supports a variety of partners, including the Regional Lead Resource Center.
If you could wrap up, sir.
Yeah. Okay, and I won't mention our other partners, but in closing, the cornerstone of lead poisoning prevention still lies in managing the aging housing stock, such that children's early life environments are not a significant source of lead exposure. Programs like those in the city of Rochester that inspect rental units for lead every 5 years have supported reductions in children's blood lead levels, surpassing statewide declines.
Thank you, sir.
Thank
you, sir. Question will be led off by Senator Rachel May.
Yes, thank you, and thank you to my colleagues for holding this hearing and to all who are here to testify on this important issue. I have a question about lead in soils, which isn't really mentioned in your testimony, but my understanding is that there's a lot of lead in some soils. We tested the lead in my backyard, and there was a considerable lead from Interstate 81 there, presumably. And what I was told was that tracking lead-infested dust into the house was a primary way that kids got poisoned, and I wonder if that is true, and what your experience is. And they said just take your shoes off when you come in the house, and you'll take care of the problem. I don't know if that's true either. So,
well, entranceway mats do capture a lot of dirt on the way in, but no, it is true that if there's lead paint on the outside of a house, or if near busy roadways historically that have deposited lead, that soil can be an important source. The LIP program, which I mentioned, is tracking children with elevated blood leads and looking at all environmental sources, including outdoor soil. So first is the indoor environment, and of course, as part of the investigation, things like toys, food, cosmetics, as well as outdoor soil. So it would be found in that regard and required to be mitigated.
Does the state help with testing lead levels in soils around a home?
That would be part of the environmental investigation. So I believe that in an investigation, we would make sure that that does occur through the local health department funding for environmental investigation, along with XRF of surfaces, et cetera.
but at a preventive level, it would not be.
But in terms of general community-wide, there are, gardening projects that are specifically, targeting lead in soil that's used for gardens, but those are usually more community-based.
Okay. Thank you.
Thank you, Senator May. Thank you, Senator May. Next, Senator Myrie.
Thank you. Thank you to Chair Rivera and Chair Kavanaugh for convening this hearing. I have the honor of representing 23 NYCHA developments, and so my questioning is going to focus on this scourge in public housing. The city of New York has made many pronouncements, announced a lot of initiatives, yet the testing remains uneven, it remains unfinished, and in some circumstances, the city has outright lied about the status of lead in public housing. I've looked at the progress of testing in my, in my own district. Some of our largest developments are still only 40% completed on lead testing, but in other developments, they're close to 70%. And we have no idea what accounts for this disparity. So I'm wondering what role you see the state playing in helping to abate this crisis in NYCHA, if any, and what suggestions you might have for us on how we can help expedite and ensure that that process is happening correctly.
Yeah, that's a fairly broad question, but we work closely with New York City Health Department and try to understand their challenges, and we compare notes. And we know that public housing has been an issue that has required a lot of catch-up and getting back on top of. Some housing units, I don't want to speak for the exact problem in particular units, but it depends upon the age of the project, and the testing, I believe, is still ongoing, and there's a catch-up program there. So how we in New York State at the state level are monitoring the blood lead results from around the state, and obviously one source of intervention is following children. But that's already after there's a problem in a child, which is not ideal. Obviously, prevention is the way to go, which is a housing-based approach, and catching up on these units where there is untested or lack of knowledge about what's going on is a good approach, and then requiring mitigation where there's chipping and peeling paint, and if there's any dilapidation leading to exposure. But
Do you think, if I may, Chair, for a follow-up, do you think that more resource allocation for inspections or the process, my understanding is NYCHA has said this is a difficult and arduous process to do, which we can appreciate, but as we have already discussed, any presence of lead is one presence too many, and so I'm wondering if there is anything that we can do, whether that's by way of the budget, to help bolster the resources to help expedite the testing.
Roger, do you have any further perspective on NYCHA and funding? It's not something that we've really gotten involved in with other than when there was the initial NYCHA crisis. We did get involved at the state level and had the federal oversight role come in to oversee that, as well as the state oversight sought it. But in terms of NYCHA's progress and funding mechanisms, that's not something that we've been getting involved in. But Roger, do you have any other perspective on that?
I don't think I have any additional comment on that, just to say that it is a large issue and a problem, and I think, as Dr. Ginsburg said in his initial testimony, that housing issues still remain to be probably the #1 issue in terms
Is your microphone
of
on, sir?
elevated.
Is the microphone on?
How about now?
I think so. Is it? There you go.
Just
If
might
you
be
could
the
just
mask.
Say that quickly.
I apologize.
We are running a little bit over time, but answer the senator so we can go to the
Yep,
next person. Go ahead.
So, I mean, it is very costly. I will just say that. So we have seen that.
Thank you, and thank you, Chair.
Thank you, Senator Marr. Next, Senator Brian Kavanaugh.
Thank you very much. I wanted to start with something you said at the very beginning of your testimony, just to clarify the scope of the problem. 39 out of every 1,000 children in the state are lead poisoned in a given year? Is that an annual, like, is it, you talked about having testing, you talked about having interventions to lower the levels of lead poisoning. Is it accurate that 4% of all children in the state are exposed to high levels of lead, are found to have been lead poisoned?
That are above the statistical level in blood, as far as for every 1,000 that are tested, yes, about 4%, which is down from about 7% in 2010.
And does that reflect the sort of cumulative, like in any given year, 4% of kids are tested as having high levels of lead?
Right, within that 1 year annual data collection.
So presumably over the course of childhood, the number would be somewhat higher than 4%? I mean, if 4% of the children this year.
Well, there is a change in blood lead levels over time as children get bigger and they have less time on the floor, and their consumption of lead goes down, and it tends to deposit in bone, and you may not find it in blood. So blood lead levels tend to lower with older ages unless there's an ongoing strong source that would keep the blood lead level high, and that's what we're trying to prevent with the testing at 1 and 2 years of age, to catch it and not just let it age out, but stop it before it becomes any worse of a problem.
And our current approach to this is that basically all children are supposed to be tested?
Yes.
And then to the extent high levels of lead exposure are identified by the blood testing, there is then an effort to remediate the problem at the source.
Right. We fund 56 counties, which is basically all of New York State, to monitor the lead testing results within their jurisdiction and to follow up with nursing care intervention and environmental intervention or investigation, and then intervention based upon what's found. So it's a bit of sometimes a research project to figure out exactly what the problem is, but most times our experience is it's chipping and peeling paint.
And my colleague, Senator Myrie, mentioned the efforts to test the homes of people who live in public housing proactively to identify lead hazards. Is there a comparable requirement that homes around the state be tested absent a finding that there's a child already exposed in that home?
So the way our CLIP program works, which is more of a primary prevention program rather than before a child tests high in a house, is for local health departments that we, again, fund to do this, to identify neighborhoods and areas that tend to have high blood lead levels, and to do surveys, walkthroughs even through the neighborhood, and go in and do investigations. Since the program started, there's been over 100,000 preventive lead inspections in homes. So that program, which we fund at $8.7 million a year, does that. But then on top of that is, for example, the City of Rochester model, which is not a statewide model in Syracuse. Onondaga just picked it up as well, which is looking at every 5 years, rental units need to be re-inspected for their lead paint hazards.
So there's no statewide requirement of that. So certain localities have implemented cyclical inspections, and those
with
are in
positive results.
In the localities you mentioned, those are required basically of all of the rental housing stock.
That's right.
Okay. Is there comparable requirements with respect to owner-occupied housing homes that people purchase?
No, not in terms of real estate transactions, if it's not a rental.
Would it be, from a public health perspective, wise to require inspections of rental housing periodically throughout the state?
Again, in terms of attacking root causes of the problem, that is certainly one approach that seems to be working. In Rochester, in 2020, it was picked up by Syracuse. It's now more than an experiment. It seems to be having positive results with declines steeper than what we're seeing statewide. So yes, that program would make sense.
Does the department track, so you get the results of lead testing in children, you notify the local departments, they do an investigation, they determine the potential risks that might be the cause. Does the department track the extent to which remediation is completed?
Yes, every child is tracked in terms of the blood lead level has to come below the target of 5 to sort of clear a case. And also, yeah, there has to be documentation that the mitigation occurred, whether, you know, it was removal of lead surfaces or covering and securing lead surfaces or remediation of other parts of the indoor-outdoor environment.
And how many units of housing had that remediation in recent years? I don't know how you keep the stats on an annual basis.
It's a hard number to
We
say.
would probably have to
We could
get back to you on specific numbers.
Okay, I'm going to yield my time to my colleagues, so I know we have a lot of questions, but I would like, if you could follow up with us on how you monitor activity and what the numbers are. Appreciate it.
Yeah.
Thank you, Senator Kavanaugh. Senator Martucci.
Thank you, Chair. My question is with respect to the recent action by the CDC to lower the blood lead reference level. As you probably know, this was lowered in October of this year. Does the department plan on doing the same here in New York?
Well, Senator, we are still working through the target of the drop from the target blood lead level that we had prior to 2019, which was 15 micrograms per deciliter for full environmental investigation, and 10, which was an initial target for initial level intervention. Now, both of those goalposts have been dropped to 5, and the caseload starting in October 2019, tripled just by going from 15/10 down to 5. So that's our goal right now. Our immediate goalpost is to try to get that case management, especially during the pandemic, and all the stumbling blocks that could put in front of local health departments. But we've provided local health departments with a lot of tools to try to make their process of investigation, outreach, and follow-up more efficient, including our LebWeb data reporting system, so that it is more efficient now, and we can really attack that caseload that's above 5. Going down to 3.5 is, of course, an ultimate goal to get as low as possible and feasible. Right now, you know, CDC is a guideline. They don't say you have to do environmental at 3.5. They don't say you have to do any kind of follow-up at 3.5, but it's a target, it's a statistical target, and certainly we'd like to get there.
All right, thank you, Doctor. And then I have one other question with about a minute left. So as you're probably aware, the annual water supply statement from water providers, must be supplied. And one of the concerns that we're hearing is this data is not easy to find. It's not centrally located. Is there something that you think the department can do in terms of collating that data, putting it in a place that's easily accessible to folks so they can have information with respect to the safety of their drinking water?
Yeah, Roger.
Senator, so we have been making strides in that way. There is a relatively new website, Know Your New York Water, which has information from both the Department of Health as well as the Department of Environmental Conservation. And on that website, we have been posting all the larger community water systems' annual water quality reports. And there's an interactive map where any resident can go, click on a community and find out, if they don't know, who their public water supplier is, and then be able to click and get a current annual water quality report. So we do agree it's important that everyone has this information readily available to them.
Excellent, thank you. And certainly, representing some smaller water districts and some rural communities, I think getting more and more online will be beneficial to folks around our state. Thanks for your testimony, and thank you, Chairman.
Thank you, Senator Martucci. Senator Ryan.
Good morning. I wanted to ask you two questions. One is about data, and then the second about is enforcement. In terms of the data, we're talking about the statewide 4%, but is looking at a statewide numbers actually give us the information? Is it spread across the state longitudinally, 4% of all children, or are there hot spots of lead in New York State?
Yeah, of course, it's not uniform. There are socioeconomic, demographic, age of housing conditions that will create those hotspots. So I don't have the statistics for each and every municipality,
Right.
but our lead poisoning prevention programs target those locations with the greatest burden of elevated blood leads. So we try to target the money where it's needed.
But that's good. So, but when we talk about this 4%, I think it's really better to focus in on the hot spots. You know, in the city of Buffalo, we have a big problem with lead. We have 4 zip codes where 40% of the children tested positive for lead. So this 4% average, I just think gives this idea that, you know, it's sort of spread naturally around, but it's really in areas where there's the, you know, the sort of two-step dance going on. Aging housing stock, but not just aging housing stock, poorly maintained housing stock. I live in a census tract where most of the houses were built before 1920, virtually no lead paint poisoning. 2 census tracts over, very different poverty rate, very different home ownership rate, 40% lead paint poisoning. So, you know, we talk a lot about these sort of statewide and what's going on, but I really think it's an easier conversation to have. It's stick-built buildings, you know, built before World War II. They're in places like Buffalo and Bath and Batavia and Syracuse. Like, that's where the kids are coming out of. I mean, you know, we sent all our parishes in Buffalo, we all got together, our churches, and we sent water to Flint. At the same weird time we were sending the water to Flint, Buffalo's lead poisoning rate was 8 times higher than Flint's. So, you know, I just think we need to focus in and we need to really, you know, get definitions down between abatement and encapsulation. I mean, the Rochester program is just a simple encapsulation program. You buy the cheapest paint you can buy and 1 paintbrush, and they drive down lead poisoning. But they do it through a series of inspections. Which brings to the second issue of this enforcement. So it sounds like the health department comes in after a child tests positive for lead. But to me, putting the resources there is, you know, really the horse is run out of the barn. But then how do we link that back? So if your health department sanitarium does a house visit and gives these recommendations to parents about how to reduce their lead risks, if in fact the house is in poor condition, does the health department say you have to do repairs and fix the walls, or does that go to a building inspector?
In the lead poisoning prevention program, where there's already a case of elevated blood lead, that is a requirement that the responsible party, the landlord, or, you know, the parents, as you say, need to fix it to retain occupancy. If it's more the City of Rochester model, then their inspection program to retain your C of O, your certification of occupancy, every 5 years, you would need to have Lead Safe House to retain the certification.
So the
Thank
city
you,
of
Senator.
Rochester has a model, but there's also New York City Local Law 1. And both those models have really driven down significantly, you know, lead poisoning in children. So I appreciate your testimony today, but, you know, I really think the more we can sort of focus on, you know, the most common denominator in childhood lead poisoning in New York State so far is kids essentially eating paint chips. There's water problems, there's a lot of other problems, but, you know, we need to keep a focus on, you know, the basic way that most children are being poisoned and try to develop plans where
Thank you,
we don't
Senator.
have to have you come in after a kid has been poisoned.
Thank you,
Agreed.
Senator.
Thank you.
Senator Brisport.
Thank you, Mr. Chair, and then thank you, directors, for your testimony today. I have 2 questions. One is a follow-up on NYCHA. The second is about staffing at the Department of Health. For NYCHA, just circling back, I heard you say you're working pretty closely with the City Department of Health. I like that. I applaud that. Have they been asking for any additional support from the state in order to implement the programs that they want to do?
Not that we're aware of. They wouldn't be going through our department to make such a budgetary request. The coordination that we do in terms of either individual cases or, you know, particular problem areas, you know, we share experience and try to problem solve with them. But, you know, that's not on a it's not shared resources in terms of staffing.
Gotcha. And my second question on staffing is, has the Department of Health experienced any staffing shortages in the previous year? And if so, how's that affected implementation of the programs that you have in place?
So when, the LIP program came under some stress because we knocked the goalpost down from 15 and 10 down to 5, there was some state funding to assist with that in terms of some of the resources we have at the state level and through the biggest gap there was the pass-through to local authorities to follow up on the elevated caseloads. While we could always, have more resources to further implement these programs, we are, making the best with, improved data tracking technology, our lead-to-web improvements to coordinate with local health departments who are really on the ground and going into all of these houses. We work with our Lead Advisory Council and our partners, try to build as efficient a network as possible in solving the problems at local levels. There's continuing to be, with COVID especially, always a need to make sure that all the effort is being put on children's blood lead.
All right, thank you.
I'm going to take a couple of minutes here. I just want you might not have some answers to these because some of these are very specific, but I want to make sure to get you on the record to see if we can get this information from you. As far as as some of the lead poisoning money for lead poisoning programs that has been budgeted in years past, could you provide information on how much of that money has actually been spent, say in the last 3 years? Sometimes a certain amount is budgeted, maybe it's not used. I figure that you don't have that in front of you.
I believe that it's pretty much all goes, Roger, do you have any other perspective? I would say it's 100%.
I would say, but Senator, we'll definitely get you that specific information.
We'll confirm that.
For the past 3 years you were looking for, sir?
Let's go with 5. Let's go with 5.
Okay, fine.
Second, and this is a kind of something to follow up on Senator Brisport's question, more specifically, how many New York State Department of Health staff in full-time equivalents are actually dedicated to lead poisoning prevention programs?
Sorry, did you say New York City or New York State?
Say again?
Did you say New York City or New York State?
New York State.
Okay. Full-time equivalents, how big is our lead program? I would say about 6 individuals.
6, 1, 2, 3, 4, 5, 6?
That are full-time, staff dedicated on managing the various programs.
I'm going to stop for 1 second there. Just 6 people.
Well, Senator, maybe just to clarify, so I think we're talking about the difference between sort of our central office.
I'm not sure if your mic is on.
Excuse me?
I'm not sure if your
Is the mic
mic
on?
is on.
Oh.
There you go. Now.
Sorry. I think Dr. Ginsburg is referring to what we consider sort of our central office staff that sort of manages the overall program. These are not staff that are actually going out and doing sort of inspections. That's a little bit of a different nuance, I think. So
Yeah, just we're not just talking about the folks in the central office.
okay, so
but
you're looking.
Oh, at our field, because we have environmental health out at our district offices in partial service counties. And so we have lead program staff out in each one of those offices.
So I'd like some information on that too.
Yeah.
Like what's the
So yeah, we can
We
provide
could
that as well.
Provide that.
Thank
yeah.
you. And so in the website, as of yesterday, the latest childhood blood lead data appears to be from 2014. Is that correct? Guess you'll have to go check, but apparently it's from 2014.
In terms of the latest update on our webpage?
Yes, as far as what's currently on the New York State Department of Health website, again, as of yesterday. It might have changed overnight, I don't know. But it seems that the data was 2014. If that's correct, if it is correct, why hasn't there been more recent data of, like, what's the issue? Because it's been 7 years, so
Yeah,
just would like to know why this...
Obviously, we'll look into that. Thank you.
Okay. And as far as the New York State Advisory Council on Lead Poisoning Prevention, it has not met in the last couple of years. And certainly a lot of it has to do with the departed, which is what I call the former administration. and the non-appointment of people, do you have a sense of whether, currently, there's people that still need to be appointed for it to be a full,
To meet quorum?
a full council, so to speak?
Yeah. Yes, we're still working on a couple of appointments, but we have had a couple come through, so we're getting closer to fully staffing the council.
Gotcha. And so there is so do you know when we'll meet again? Do you have a sense of when that will happen?
We're looking at meeting as soon as we can in 2022.
Okay. And, all right. Okay, we'll do 3 minutes for follow-up for the chair here. Thank you. Senator Kavanaugh.
Thank you. Just to follow up on Senator Rivera's questions. So on the Public Health Law, the Advisory Council is supposed to produce an annual report due December 1st. Maybe we should have waited till tomorrow to have this hearing, but I mean, notwithstanding kind of vacancies on the council, is that report something the department is going to produce?
I'm sorry, can you just repeat the?
I'm saying the Public Health Law requires the Advisory Council to
The
produce an
advisory
annual
council
report
to produce a report.
on the state of lead testing and also recommendations for the governor and the legislature about how to improve the situation. Is that, I mean, I
Yeah, no,
assume
that's-
you'd know about if that report really
Yeah,
works.
that's not imminently being developed, but it will be worked on with the council as soon as we get a quorum to meet again.
Are you aware of any recommendations that requirement has been in place for about a decade, at least, I think, the requirement that such an annual report be produced? I think it has been produced in some years. Are you aware of any recommendations that the Advisory Council or the department have made to reduce the incidence of lead poisoning in the state that have not been implemented by the legislature and the governor?
No, I'd have to review past reports, but in general, the advice of the council is taken extremely seriously, and we look at how we can implement it and work with the council on, fine-tuning what goes into the report.
Does the department have an overall sense of the level of effort it would take to basically eliminate lead poisoning among children in the state? Like what kind of resources would it take to do the remediation, the testing and remediation necessary to end a situation where, again, I said 4%. I was not trying to minimize it. As my colleague, Senator Ryan, noted, that 4% is highly concentrated in certain areas. But the idea that 4% of all children in the state are being subject to this poisoning is really, I think, just an astonishing thing. But is there, what level of effort would it take? What level of funding? What are the things that we ought to be making sure happen in order to eliminate this problem?
Well, we do know that when the when the target dropped from 15 and 10 down to 5, there were no additional resources to meet that higher caseload. And of course, every child that is above 5 that we can bring below 5 is also improving housing. It's, again, sort of a backwards approach because we're chasing cases rather than primary prevention of housing. But the more follow-up and the more funding that goes into both the LIP effort, which is the case management, and the CLIP program, which is, again, more primary prevention of housing, the greater the effort will be. I mean, I think those are very well spent dollars. Any declines that we have seen over time have been at least in part due to those programs. And again, when the definition of elevated blood lead dropped to 5, no additional resources were given to localities for that.
And the department hasn't recommended any additional resources be given to localities?
Well, at the time, there was a budget initiative.
Just a couple quick questions. How much does it cost typically to remediate an apartment where a child is being exposed to lead?
I'm sure it's a variable number. We'd have to get back to you with that estimate, but certainly that's a good question.
Based on the department's data, the blood testing data, is there any ability to assess an approximate number of apartments or approximate portion of the housing stock that is dangerously exposing people to lead? Or does the department try to do any of that analysis?
Yeah, what's the total universe that needs to be mitigated? Again, we see a fraction of it in the elevated cases, so we know what the caseload is per year, as we talked about. It's a greater number than that, but we don't have any more definition without doing all the inspections, which,
Okay.
again,
So I
you, Senator.
appreciate, I'll end it there just to say that obviously, you know, this is a problem that crosses over the jurisdiction of your agency and the housing agencies. We did invite both the state and the city housing agency, New York City housing agencies to testify. They're not appearing in person, but they will provide testimony in writing, but we're reviewing that, and I think we will be looking to the department for, you know, recommendations and guidance on how to address this problem going forward.
Thank
And
you.
as I
We will
thank both of
happy
you
to do
gentlemen
that.
for being here this morning, I will remind you, you have plenty of homework. We will make sure that all of these things are followed up on. Thank you so much for being here this morning.
Thank you.
Second panel will be Sarah Ravenhall, the Executive Director of the New York State Association of County Health Officials. Good morning, Ms. Ravenhall. You may begin whenever you are ready.
Good morning.
Morning.
Senator Rivera, Senator Kavanaugh, and honorable members of the Senate Standing Committees on Health and Housing, Construction and Community Development, on behalf of the 58 local health departments in New York State, thank you for the opportunity to share the local health department and county government perspectives regarding reducing the burden of lead poisoning in children. NYSEGO fully supports policy changes that reduce the incidence of lead poisoning. However, no matter how well-intended a policy may be, it will have little value if it cannot be effectively implemented because of resource limitations. Effective policy, therefore, must be predicated on our state leaders' willingness to provide the sustainable and flexible fiscal resources needed for that implementation. The public health system in New York State is in crisis. Numerous elements have intersected to weaken our public health response infrastructure to a point of unprecedented fragility. 10 consecutive years of disinvestment by state totaling more than $150 million in cuts, a demoralized public health system, the ongoing response to the COVID pandemic, and the specter of an unanticipated wave of public health staff retirements that will further diminish our response and prevention capabilities. Over the past several years, the number of staff delivering Article 6 core services has declined. According to data from the state, the number of FTEs working on Article 6 services declined by 7% between 2015 and 20. During the same period, the population of the state increased by 3%, and the breadth of their mission exploded due to the pandemic. The reduction in staff has made it harder for New York State's local health departments to address the public health challenges facing their communities. According to the Public Health Center for Innovations and the de Beaumont Foundation, local health departments nationally need 54,000 new staff to be able to provide adequate infrastructure and a minimum package of public health services, which includes lead poisoning prevention and abatement responsibilities. We must meet that need here in New York State. As you're aware, the pandemic presents serious risks to children, including increased risk of lead poisoning due to reductions in lead testing, children remaining indoors in home settings with potentially prolonged exposures to lead, and the inability to conduct in-home public health visits during the New York on-pause orders. Additionally, financial challenges incurred by property owners due to tenants' inability to pay rent during the pandemic are also likely to contribute to delays in abatement activities and ongoing maintenance. We urge the legislature to identify funding to support current and future lead poisoning prevention activities, both primary and secondary. Your leadership and support has never been needed more to protect the lives and health of people of New York. NYSEGO thanks the legislature for its ongoing leadership on this public health issue, and we are committed to working with you to identify the resources needed to move your efforts forward. Thank you.
Perfect timing, Ms. Ravenhall. Just a quick note. When you folks made the copies of your testimony, it was double-sided pages, but you always only give us one page. So,
Oh, no.
yes.
I am so sorry.
So it goes from page 4 to page 6.
I
to
will
page
get
8.
that to you immediately.
So
I am so
please
sorry.
get us the
Terrible.
full version of your testimony. But
Oh.
thank you so much for being right on time. We'll lead off by Senator Kavanaugh.
I will just say the even pages really did have a lot of material.
Yes, exactly. Yes.
Can you talk, your testimony toward, and thank you for summarizing, but you, toward the end of your testimony, at least the parts I have, you talk about commentary on various pieces of legislation that we can, and questions that the committee has about them. Can you talk about, do we have? Okay, we appear to have, presumably from an electronic version, have full copies
thank
now.
you.
So.
Thank you.
So from your perspective, you represent the county officials. Is that every county every
Correct,
county is
including New
represented
York
by your
City.
organization?
Yes.
Do you, I assume you're here for my questions for the state health department. Does your organization have a sense of the scope of the remediation that would be necessary to basically eliminate lead poisoning hazards in the state? How many units, how much money it would take, what the scale of the problem we're facing is?
Yeah, so there's so many different strategies that we could be talking about. So the full scope, I can work on getting a realistic picture. I think that the first step I can talk about would be to fund lowering the elevated blood lead level from 10 or 15 down to 5. So when we went down to that 5, there was no additional funding to hire the nursing staff or environmental health inspectors to do that work. And we know, we estimate that would cost about $30.3 million. And furthermore, that it would need to be put into an existing grant mechanism. So the lead prevention program grant would be an appropriate place to allocate that type of funding. Article 6 funding doesn't cover fringe expenses, and so it does not give the localities the ability to hire those experts that are needed to support the families or go into homes and do those inspections.
Okay, and most of those measures you just talked about are kind of the testing, monitoring, kind of the administration of the screening programs, which are of course very important. But I guess, I would support increases in those sorts of funding. But just trying to get to the question of how we cut off the source of this poisoning. As somebody from the health department said, we're currently testing people and then going back and trying to address the situation.
Right.
Is there any analysis you're aware of the overall scope of what would be necessary to actually address these problems at their source?
I know that there are some academic partners who have done studies on this, and I can go back and you may actually hear from them today. There are some figures that I've looked at. I can't recite them off the top of my head, so I can try to share that with you. I think you can't deny there's a housing crisis in New York State. We have an older housing stock, and that certainly is something that needs to be addressed, and making sure that when there is remediation that's done, that the tenants don't get moved out of their house or have nowhere to go. That's a huge priority as well. So there are a lot of components to this work.
Right, and that's, I guess, as you may know, Chair of the Housing Committee, and very much focused on the housing crisis. And we are at a moment, I mentioned in my opening remarks, we have potentially a lot of money coming from the federal government to address the housing situation. We're also at the beginning of a 5-year capital plan for housing, which we're expecting to be part of the governor's executive proposal and will be negotiated in the next few months. So there really is an opportunity, but I think a lot of that effort is going to focus on ensuring we're addressing the funds we have to the priorities. And it seems to me that preventing environmental problems like lead poisoning in people's homes has been a critically neglected problem for a while. Right. And something we'd like to address. I would also note that the Senate the Housing and Investigations and Ops Committee have spent a lot of time working on code enforcement and the various deficiencies around the state in local code enforcement efforts, and the lack of state support for those.
So on the Rochester model and the use of code enforcement, which is a gold standard and we'd love to see replicated across the state, but one of the things I do hear from the local health departments in the counties is that code enforcement, particularly in rural counties, is limited. So they may have like half an FTE code enforcement, or they may have a code enforcement staff that oversees multiple jurisdictions or counties. And so they don't have enough capacity in code enforcement to replicate the Rochester model, which is such a fabulous model.
But again, from a public health perspective, as a representative of county health officials, it would be wise to have a process of systematically inspecting residential
Yes,
real
we
estate around the state.
typically support policies as long as they're resourced effectively. That would lower the EBLL in children, absolutely, from a public health perspective.
Okay, thank you.
Thank you, Ms. Ravenhall. I will take a little privilege of the chair to point out that we have been joined by Senator Cordell Clear. Let's give her a hand. As I mentioned earlier, she is like a brand spanking new senator, and even though technically she is not a member of any committee yet, we wanted to make sure that she was a part of today's hearing based on the expertise that she had on her, let's say, civilian life before she joined us in the Senate. We're very happy to have you, Senator Clear, and I'll give you even a minute if you'd want to particularly based on your expertise, if you'd want to.
No, I just wanted to thank you for holding this hearing. It's very crucial and important. I was fortunate enough.
Is your microphone on, Senator?
Oh, I don't know. Is it on? Okay, I got to
good.
get closer to it.
There you go.
Get used to speaking with this mask on. I want to thank you very much, Senator Rivera, for holding this very important hearing. Lead poisoning is the most preventable environmental disease that is out there, and having done so much work with Matthew Shasher and the Coalition to End Lead Poisoning in New York City, I certainly want those protections for children all across the state of New York. And as a parent of a child who was affected by lead poisoning, knowing what it could do to stop any other family from going through this, I know how important this hearing is today. So this is a great thing that we're doing, and we really need to pass legislation. It's past time that the rest of the state was protected. So thank you so much.
Senator Clear, thank you so much.
And I would just note that the Senate Housing Committee is maneuvering to try to get Senator Clear to be a member of our committee when the majority leader makes the appointments.
All right. Next, I have Senator Ryan.
So I wanted to follow up with you on the issue of prevention and how the inspections work. So if a public health sanitarium, goes to a house because a child has been poisoned there, and the family decides, we're already moved to a new apartment, do the public health officials still go to the old apartment where the poisoning take place to make sure repairs are done, or do they just follow the child to the new place?
Oh, that is such a great question. That is so specific and probably very situational. I am not sure. I mean, I think it makes sense to follow the child because the child may be picking up that being exposed to lead at school or at grandma's house, or it's really a case. As far as are they looking in that home after the child has left, I'm not sure.
Right, so usually when the health folks come in, they want to make sure the child is healthy. So if they were exposed to health a health risk through lead at a certain apartment and the family moves, then they then concentrate on making sure the new apartment is lead safe. But you know what that does? That allows the landlord to put a big for rent sign up for a new family to come in to have their child poisoned. And we see, looking at the county health data, it's as if these houses they're like serial poisoners. That it's the same house over and over again who's poisoning children. And usually when families in low vacancy areas like Buffalo and Binghamton, when you get poisoned, you don't stick around to fight with your landlord, you move.
Right.
Thus, this cycle of poisoning continues in our communities, and that's how we get to like 40% in certain Buffalo neighborhoods, because those are areas where people are moving in and out. But this is that disconnect, right, between the public health and what Senator Kavanaugh was speaking of, the issue of inspections, which isn't a public health part. That's sort of the city or the county code enforcement. So, peeling paint may be a health problem if in fact it's lead paint. But if it's not lead paint, it's just a building inspection problem. So, we see these serial houses. It's the same houses poisoning kids over and over again, which really means we have to marry our programs of the public health and the inspections. And, we've got one-offs that have done that, like Rochester, like New York City local law #1. But, I just think that, every year, I have to get my car inspected to say it's safe to drive on a road. If you're putting a product into the consumer stream, i.e. a house, to say it's safe for kids, but there's no inspection mechanism. So,
Right.
I think we just need to come up with some good policies that take health and housing together. And I think if we do that, we could drastically reduce the most preventable form of lead paint poisoning, and that is just simple chipping paint in bad maintenance.
And I think what you're saying is spot on. Couldn't agree more. I think that as long as there are policies that are resourced, they're good policies. Our local health department experts are fabulous. They know what they're doing. They know how to work with their communities. They know health equity. They go into their communities and they know how to work with them. And if there are resources put into place so that we can hire the staff to do this incredibly important work, we're there, and we'll be your partner in this.
Yeah, and I agree with that, but I would also, make the point that I don't know if any counties have come to us to say we would like a pilot. We would like to do this proactive work as opposed to just treating poisoned children. So I would invite you, when you go back to your organization, to ask counties if they can come up with things that would work in their communities.
Thank you, Senator Ryan.
We recognize communities are all different, but
Yeah.
Thank you, Senator
happy
Ryan.
to hear from you.
Thank you, Senator Ryan. Senator May.
Yeah, thank you, and thanks for your testimony. I want to come back to a question I asked before about lead in soils, because I'm interested in how much the kinds of interventions and education that are undertaken are grounded in science. I'm looking at a report from EPA from 2017 that shows that babies up to 6 months, their lead in water was one of the major sources of lead poisoning for them. But once they're over a year old, a year to 6 years old, water is much less, and dust and soil are big, and food is actually a big source for them. And so I'm just wondering, is that kind of information informing the work that you do?
Yeah, all of the work that the local health departments engage in is evidence-based. They really follow the science. They look at data. They collect data and make informed decisions based on that and what's in the best interest of the child. So every time there's a child with a BLL over 5, it's really an investigation to find out what that source may be. Is it soil? Is it water? Is it lead paint? Is it spices in the cabinet? It could be so many different things, and they work with that family to kind of help remediate the situation. I think, if you're interested in some data, we have an environmental health committee that looks at these types of issues and looks at policies that would lower lead exposure in children. I could certainly speak with them, the chairs of that committee, and get you some more information.
Thank you. And do you know, because I was surprised by the degree to which food was part of the problem, not for the kids with the very highest levels, but the whole rest of the range. Food was a big source, and I don't even understand how food.
Yeah, sometimes I believe my understanding is when they're imported spices, they may contain some levels of lead, and so that has been found to be a source.
Okay, so is that part of your education?
Oh,
as
yes.
well? Okay,
Oh, yes,
great. Thank you very much.
absolutely.
Thank you, Senator May. Senator Mannion.
Thank you, Senator Rivera. Thank you for conducting this important hearing. I represent, along with Senator May, the city of Syracuse, which has a aging housing stock, aging infrastructure, and I believe that the city and the county are committed to progressing. There's certainly some awful history there. My question also is about source. Two questions, most likely, is when we just, at Senator Rivera's legislation, it passed both houses. We're hopeful that it is signed by the governor in increasing the frequency of testing of water in schools and also lowering the threshold of an acceptable level of that water. Do school districts report to the county health departments? Do they report to the state DOH or state ed, or all of those? Do you know who they report to?
This is probably a question that we should be asking Dr. Ginsburg and
Sorry.
the State
Yes.
Department of Health. I believe that the schools are reporting to the state.
Thank you. I appreciate that. You're
But
correct.
I will say, local health departments work very closely with their school counterparts and help support them, provide technical assistance to do that testing in the school drinking water. So the local health departments are engaged in that effort.
If we talk about the investigation of sources, my guess would be that the top two are water entering the home and lead paint. Where does lead in water in schools fall if you were to add any type of quantitative number to that or otherwise?
I bet some of the experts in the audience right now are like,
Sure.
come on, I know the answer to that. I'm sorry, I don't know. I'd have to get back to you with more information on that, where that
Gotcha.
falls.
Yes. And I apologize for not asking the
Oh,
previous
no,
group.
absolutely. Happy to get back to you with
I'm
more
going to give you one
information.
more on this, and it might be good for any other individuals submitting testimony later, which is we also had legislation that did not advance regarding lead in ammunition. So from your experience, is this a, I'm going to use a scientific word, which would be significant. Is this a significant concern? Do we see that the source is found from lead dust from ammunition?
Right.
Frequently?
I know that that's a possibility, especially if somebody in the family hunts. Probably more common in your rural counties. I don't know about the significance or frequency in which we see that, but it is certainly something that's been detected and seen.
Thank you.
Thank you so much, Senator Mannion. Senator Myrie.
Thank you, Chair Rivera, and welcome again to Senator Clear. There is no better initiation into the Senate than having trouble with your mic. We are very happy to have you here with us. I wanted to ask you about the civil liability piece of your testimony.
Yeah.
Wondering if you could give me some clarity on what you are advocating for or the point that you're making. I read through it, and it sort of says what the legal standard is for county liability. And I'm not sure if you are asking for greater civil liability for manufacturers and landlords, or that you're just sort of stating that counties can be on the hook for not abating lead in an appropriate fashion. We have a history of litigation against NYCHA in the city on this, and that has led, I think, to some improvements in the process. And so I'm just wondering what the advocacy point is there.
Yeah, the point there is that good policy is resource policy, and when policy passes without the resources needed to do that work, we can be on the hook. And, for counties, and especially smaller counties, to be subject to civil penalties or litigation, it really just eats up resources, and we want to focus on public health. So the message there is resources. We need resources to do this work. We want to do this work.
Got it. Thank you.
Thank you, Senator Myrie. Senator Brisport.
Thank you, Mr. Chair, and thank you, Director. I really appreciate your testimony. I had just a question about your budget request, specifically the Article 6 base grant. I just wanted a better sense of how the numbers were determined. So I agree with, in general, investing more deeply in the workforce, but I'm seeing 750,000 for full service, 577 for partial service. So how were those determined, and what would those do?
Yeah, that is, those were determined based on what our membership felt is appropriate for a budget request, and we haven't seen an increase in Article 6 in about a decade. So, more importantly with our Article 6 request is that fringe expenses are covered at that 36% beyond the base grant reimbursement. That's our infrastructure package that we're going to be asking for in the next executive budget and state budget. We are just looking at a really, a public health workforce that has been weakened because of the pandemic, and what that would do is allow us to provide core public health services. We're talking about lead, we're talking about opioid, chronic diseases, we're talking about maternal child health, all of the services that we are legally obligated to provide under Article 6 state law. It would allow us to hire up and make sure that we're strengthening our public health infrastructure as a state, and provide these services to the public and reduce negative health outcomes. So I wouldn't say that for the base grant piece of that request, there was any scientific basis. It was determined based on what our members, the county health officials, felt would be useful to them to do this work.
Okay, yeah, if possible, I would like an explanation later or more data later of why that number versus 100,000 or versus 10 million, where that was determined.
Okay, sounds good.
Thank you.
Thank you, Senator Brisport. Last but certainly not least, Senator Clear.
Okay, thank you again. My question is related to Senator Briscoe's question. I wanted to know what section of this money, what portion of this is about enforcement, because laws are good, and I do realize without enforcement, it really doesn't help. And I think that's the way to prevention, is really to enforce what is out there to protect children. So is there a budget for what it would take to bring about enforcement just on the lead paint issue? Because it's my understanding that most children are severely lead poisoning from deteriorating paint. That is the cause. And we certainly don't want families to have to choose between poisoning and being homeless.
Yes.
It's not a good choice. So what would it take for counties to be able to enforce these inspections?
Absolutely, that's a great question. Thank you, Senator. Right now, there are 15 counties funded to do the primary prevention work. So when you're talking about enforcement, you're talking about enforcement of the property owners to do the remediation when there is a lead problem in the home. There are only 15 counties funded to do this right now. So I can look into it and find out what the actual financial figure would be, but part of the responsibility of those 15 counties is the enforcement piece, absolutely. And they have the authority to do that. But I don't have a number off the top of my head, and I can get back to you. I think that's incredibly important.
Thank you, Senator Clear. And just a quick follow-up on the issue of the request that you're going to be making to the executive. Since you've mentioned in the past that when the change happened from 10 to 5, that the $9.7 million that was allocated was not enough. You said that the floor was 30 million at the time?
30.3.
Oh, pardon me, 30.3. What would be the ideal, what is the request that you're making for the executive, is it 30.3 this coming budget season?
That would be for the lead piece, yes. The Article 6 piece is $87.5 million.
Okay.
That includes the covering of fringe benefits for local health department staff. So that's a separate request. 30.3 would cover the lowering of the elevated blood lead level down to 5.
So the whole thing would be like 111, like $111 million?
That sounds about right.
$111 million total?
Yes.
Between the both of them? Okay. Thank you, Ms. Ravenhall.
Absolutely. Thank you for the opportunity.
Moving on to the third panel, Bobby Wilding, the Executive Director of Clean and Healthy New York, Russ Haven, General Counsel for the New York Public Interest Research Group, and Matthew Shashir, Staff Attorney for the Northern Manhattan Improvement Corporation. And considering, Mr. Shashir, that I believe that your testimony was 54 pages long, I would ask you to please not read it. And you folks can start, Ms. Wilding, you can go ahead.
Thank you so much. Is the mic working? Can you hear it now?
I believe so.
Hello?
Sing a little ditty.
Try one more time.
Who here in the back over there? La 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 la. Go like that in it, the thing. Okay, so it's not on.
See if this mic.
There you go, that one works.
All right. Good morning. Thank you so much, Senator Rivera and Senator Kavanaugh and all of the committee members who are here today, and for your staff for convening this really critical hearing. My name is Bobby Wilding. I'm the Executive Director of Clean and Healthy New York. I've been an advocate for environmental health and justice for nearly a quarter of a century. I'm a mom of 2 kids, and I live in the rural county of Schoharie. For the last 15 years, Clean and Healthy New York has worked to build a just and healthy society in which toxic chemicals are unthinkable. And we co-lead the Lead-Free Kids New York Coalition and the Just Green Partnership. And through both of those coalitions, which include numerous organizations from a wide variety of perspectives, we are seeking to advance lead elimination policies and investments. And I want to deviate from my comments, and you have my printed testimony. Dr. Ginsburg said that New York State has 4% of its children who have above 5 micrograms per deciliter. The national level that is set, that just dropped, is set at the 2.5% nationally of children. So if 4% of New York's children have blood lead levels above 5 micrograms per deciliter, that we have to expect that there's actually significantly more disproportionate to what is happening nationally, that the number across the country is down to 2.5 micrograms per deciliter. Clearly, we are not solving this problem fast enough, and you've heard that over and over again. Just a note, it's not a surprise given that we have the oldest homes in the country with a median age of 60 years. So what we have been working on are several policies that we really hope the Senate will pick up and advance this year. There are other components to address lead poisoning, but I just want to briefly highlight the 4 that were adopted by the Lead-Free Kids New York Coalition this year. The first is S2122A, Senator Rivera's bill to address and strengthen the work to eliminate lead in school drinking water. That, of course, has passed both houses, and we're looking forward to Governor Hochul signing that legislation into law. Senate 2142A, Senator Kavanaugh's bill, which would require residential property sellers to test for and disclose the presence of lead at point of sale. This will not only benefit the buyers, but also in the case where the property goes out to be rented, the landlords would then affirmatively know whether or not there was lead paint and have to disclose that. Right now, if they don't know, they don't have to say anything. And so this closes that really important loophole. S6554, Senator Bailey's bill, would require New York State to adopt the federal regulations, the enforcement and implementation of the renovation, repair, and painting rule. This has been implemented in 24 other states and has been incredibly effective in ensuring that those requirements are being upheld. Having enforcement being more locally centered makes a huge difference. And then finally, S3079, Senator Ryan's bill, that requires landlords to have insurance policies that cover tenants' losses and damages in the event that they have a family member that's poisoned by the lead paint. This has the effect of driving insurance companies to work with landlords. It creates another pressure point to drive them to ensure that their properties are well maintained and to be proactive. We also recently sent a letter to Governor Hochul urging investing $1 billion in the state budget for a bold lead poisoning elimination project. And as you've heard from speakers before now, we have fallen behind in financial investments, and those kind of resources are vital. So we urge you to work with the governor and the assembly to implement these and to secure these necessary resources to finally eliminate lead poisoning once and for all. Thank you.
My name's Russ Haven, and I'm General Counsel for the New York Public Interest Research Group, NYPIRG. This hearing is very, very important.
Microphone a little bit closer to you. Remember, the mask makes it a little bit tougher to hear, so just bring it a little bit closer.
This hearing is very important and very timely. 50 years after New York banned the sale of lead paint, childhood lead poisoning is at epidemic levels in New York State. You can decide as a legislative body to take decisive action and finally end the lead poisoning epidemic. Use this hearing to create a baseline of information, a public record of the devastating problem, look at what the responses have been at the state level and the local level, and create a plan of action to finally attack this problem. 50 years. With your leadership, a new administration in place, federal infrastructure funds in the pipeline, we can finally turn the corner and step up and address this problem. Because this issue disproportionately affects communities of color and low-income New Yorkers, this is not only a housing and public health issue, it's a civil rights, environmental, and social justice issue. Many think lead poisoning is so 1970s. Kids sitting around in their diapers eating chips off the wall. But really, this is about invisible lead dust that parents can't see and they are not equipped to deal with. We've sold an enormous amount of lead and paint. In some cases, hundreds of pounds of paint might have been applied to interior walls. It's a toxic metal. It doesn't go anywhere. It doesn't evaporate. That's why we have a toxic legacy in bedrooms and living rooms throughout the state. It's like you had little miniature toxic waste sites in people's homes. The only way to deal with it is either to remove it, contain it, or maintain it properly through vigilance and regular inspection. As we heard today, generations of New Yorkers have been lead poisoned, often in the very same housing units, in some cases within the very same families. There was 3 generations of the Brooklyn family were all poisoned in the same unit. This is insanity. I'm just going to go through a quick recap of what we've done over the last 30 years. Mario Cuomo in 1992 proposed a universal screening law. He also proposed fixing the equivalent of 25 cents per gallon paint surcharge for paint manufacturers to fund lead programs. The universal screening law passed. The fee system did not. The Pataki administrations and Pattern administrations, Pataki did almost nothing on this. Governor Patterson, vetoed a comprehensive bill in 2008 saying that it was too expensive and duplicated what the Department of Health did. The Cuomo administration, I'll just point out one thing, it spent 7 years without acting to lower the blood lead level. It had to come from the legislature. It didn't get done until 2019, and as we heard, there were insufficient resources made available to deal with the spike. You can conjecture about why that wasn't done.
Because he was terrible. Thank you so much, Mr. Haven. Mr. Shashir.
Right. Just to wrap up.
No, if you could, thank you.
Yeah.
We're good. We'll come back to you for questions.
Okay, very good.
Thank you.
Thank you. I'm a staff attorney at Northern Manhattan Improvement Corporation. And I've been engaged in the issue of childhood lead poisoning prevention, primarily in my role as counsel to the New York City Coalition to End Lead Poisoning for about 30 years. I've been part of litigation at the state and federal level on the meaning, enforcement, and validity of various laws about lead poisoning prevention, including federal, state, and local. I was heavily involved in drafting what's now known as New York City's Local Law 1 of 2004 and other bills. And for the past decade and a half, I've served on the State Lead Advisory Committee, which, as was pointed out, has not met in years. And notwithstanding what Dr. Ginsburg said, our recommendations have never been acted on, and nor have the reports been issued for years. The fundamental issue before us in New York State, which has the highest number of dwellings with lead paint in the country, and the highest number of poisonings of children in the country as well, not surprisingly, largely continues to base its response to this wholly preventable epidemic by the barbaric use of children as coal miners' canaries to detect the presence of a neurotoxin in their home. New York neither has on its laws, on the books, nor an enforcement mechanism to prevent lead poisoning, or what's called primary prevention. Instead, New York continues to rely on secondary interventions, a system that takes no action until a child's been found to be lead poisoned, even though it's well understood that the damage that's done to a child from lead poisoning is permanent. In short, rather than test buildings for lead, New York's policy continues to be to test children for lead as a means to detect lead in their home environment. Half a century ago, New York passed Title 10 of Article 13 of the Public Health Law and said, oh, the occurrence of lead poisoning is a major public health concern and will require concerted efforts of public health agencies. 50 years later, we have more children with elevated blood levels than any other state, with our estimate being it may be as much as over 100,000 children at 5 micrograms per deciliter or greater. The current laws have never provided any meaningful remedies for families with children at risk. The 1970 enactment in Title 10 banned the application of lead paint and granted the health commissioner the power, but not the mandate, to declare housing with conditions conducive to lead as high risk, and the power, but again not the mandate, to order removal of that. The courts have repeatedly declared that these are not enforceable mandates that can be enforced by families with kids at risk, none whatsoever. And as a tenant's attorney, I can tell you that if a family with young children comes to my office for assistance with a lead paint hazard in New York City, we know how to assist them. But before their child is lead poisoned. But if I was an attorney practicing in Utica or Newburgh, I would have nothing to offer them other than to say, well, come back to me once your kid's lead poisoned, and then we can get the health department to intervene. Shockingly and sadly, there is in fact no state law or regulation on the books whatsoever that currently requires that a landlord abate lead-based paint hazards before a child becomes lead poisoned. None. And don't take my word for it. The courts have repeatedly declared in personal injury cases that landlords had no such obligation, and therefore there was no duty on the landlord and no negligence. And even if such laws were in existence, there are no effective mechanisms by tenants to invoke those laws. So in summation, I think the key issue here is having meaningful enforcement. And some of the key elements of that is we have to have a code that mandates that residential rental properties with kids under 6 are maintained at all times in a condition that does not cause lead poisoning, a requirement that residential properties be regularly inspected by somebody, a mechanism that tenants can obtain timely and adequate inspections and enforcement, a publicly available database, as we have in New York City, of where the homes are with lead paint violations.
Mr. Scheer, one quick question. How many more do you have?
Pardon?
How many more do you have as far as like quick recommendations? Start my time, please. So I'm going to give you a little bit of time from my time so that you can finish those recommendations. Then I will come back to you, Mr. Haven, using my time, but I want to make sure that there's, because I did interrupt you not only because it was true, because the last administration was terrible, but also I wanted you to go a little bit deeper into the way that the past administration, the departed as I called them, failed in this particular regard. Mr. Scheer, finish your
I will,
last
and
part,
this
please.
is all in my testimony. So
Gotcha.
provisions that evictions or a vacate order does not negate the mandate to cure the lead violations, a private right of action for tenants to seek enforcement of statutory and regulatory mandates around lead poisoning, a provision that lead paint hazards are rent impairing violations, and prohibitions against retaliations for tenants who have lead-based paint hazards. Much more of this is laid out in my testimony. I also have a 350-page book here on the lead paint laws. I gave a copy to your staff, Senator.
Yes.
And I'll give one to Senator Kavanaugh. And lastly, I do hope, Senator Myrie or Brisport, you asked me about NYCHA and about the liability for the local health departments. The local health departments, the Court of Appeals has declared in Pelez versus said, and it's in my papers, that basically they're immune from litigation liability. So that's not an excuse for them to not take more definitive action. Thank you.
Thank you so much. So, Mr. Haven, again, since we're in my time, the question that I have for you is, how terrible was The Departed as it relates to this particular issue?
I'm sorry, it's difficult to hear, sorry.
I said, how, because when you in the part of your testimony, you talked about Pataki, you talked about the Patterson administration, and then you spoke about the administration of what I refer to as The Departed. This is terrible Cuomo, that guy. So you were talking about how, and I know that it's been a repeating pattern in a couple of the testimonies, as far as how the last 11 years have not been, in this regard, as it relates specifically to lead poisoning, there was not good efforts done by the administration. So if you could go a little bit deeper into that, because I believe that's where I cut you off.
Yeah, Governor Cuomo was, before he became Attorney General, he was Secretary of the U.S. Department of Housing and Urban Development. He was at that agency for, I think, 7 or 8 or 9 years. Before that, he ran a not-for-profit housing group. So we were optimistic when he came in, and after 12 years, nearly 12 years of his administration, there were no advancements on lead poisoning prevention. We had trouble getting budget numbers out of the administration. I suspect, but don't know, that the funding levels that the Cuomo administration put forward were about the same that the ones Patterson had in 2008. Again, the most telling thing is that for 7 years, the Department of Health has the power. They could have lowered the action level, the reference level, to intervene when a child is poisoned. Instead, it took the legislature to force the governor's hand.
Yeah, quite aware. It was my bill.
Right. In fact, when I first saw the bill, I was shocked because I had assumed that we were in lockstep with the CDC on this. And you heard about the data on the website. I visited the website. It's 2014 data.
So it is 2014.
They have the data. Mm-hmm. They have the data. There's 7 years of data. And what happened when you moved from 10 to 5? You had a lot more kids who were lead poisoned. That's just the way it works. And so that cried out for a bigger response, yet none was forthcoming from the Cuomo administration.
It is our expectation that this is one of the reasons why this hearing is so important as far as the timing is concerned, because we do have a new administration. So I'm hoping that, I know that they're listening, and I'm hoping that as it comes to next year's budget, which we should just, literally in a few weeks, we will know what the priorities are of the administration in this regard. Thank you, Mr. Haven. Senator Kavanaugh.
Thank you all for your testimony today, and also, I've had the opportunity to speak with each of you about these issues in the past, especially Mr. Shisher, who is really one of the state's leading experts on this topic. I've asked various versions of this question today, but and you all focus a lot on creating the kind of regulatory infrastructure that would be necessary to identify the problem, to create levels of liability that might cause people to act. Are you aware of any analysis of the scale of the work that would be necessary to address the problem, the actual remediation that needs to happen? I mean, putting aside the question of who pays for it and how, to the extent to which landlords are responsible for it versus grant programs or otherwise. I'm just trying to get a sense as as someone who focuses on housing spending, trying to figure out what is this, trying to get a sense of what the scale of this problem is if we wanted to address it at the source.
In the scale in terms of how much would be needed to be spent to eliminate the problem?
Yes.
I don't know, but what I do know is that the numbers that have been published in any number of studies in the peer-reviewed public health literature indicate that the amount to be spent on childhood lead poisoning is enormously surpassed by the amount of financial damage it costs to the public, to the families, and to the state as a whole. I can tell you, for example, that in New York City a number of years ago, there was one case with one family poisoned where the damages that were assessed by the court was the equivalent for that one family of the entire state budget on childhood lead poisoning prevention. So it's really a question of, who's going to bear the cost? Is it going to be, predominantly poor children of color, or is it going to be the state as a whole that's going to finally get down to business and take care of this? And these laws could be structured in any number of ways. New York City's approach is to say, landlords, it's your property, you need to inspect it regularly. Rochester and Syracuse have gone with a different model, which is to say we're going to use public tax dollars and do the inspections. Whatever model works, there needs to be a fundamental shift in the paradigm here that says that housing has to be maintained in a safe condition that doesn't poison its occupants. How much that's going to cost? We've never had really a bill that's gone anywhere that's even had that kind of analysis. We've proposed bills like that, so that's something that people could figure out. I don't know what that number would be. I can tell you that when we were promoting Local Law 1 in New York City Council, we had experts testifying that lead poisoning was costing New York City $2 billion a year. I think the first year's enforcement cost of Local Law 1 was about $100 million.
So a small fraction. Okay, and as you know, I'm very committed to answering your basic question about whether we're going to continue to put the burden on children and other occupants of these homes, or we're going to take on the burden as a state and address it. I'm very committed to answering that question by a commitment to the latter option.
Yeah.
So, but I'll leave it there and see if my colleagues have other questions.
Thank you, Senator Kavanaugh. Senator May.
Yeah, thank you. Ms. Wilding, I wanted to ask you, you mentioned the governor's proposal of $1 billion for lead prevention and elimination. Do you have a sense of how that would be administered? Would the money go to landlords? Would tenants apply? How should it be administered? Do you have?
Yeah, so we have break that down into several buckets in terms of our recommendations. We're recommending that $100 million go to the Department of Health to expand their lead web program so we actually get timely, actionable information as we're dealing with the kids who have been poisoned, and to ensure program oversight. We propose $200 million to go to the local county lead prevention programs and do primary prevention through the Departments of Health. Half of the $1 billion we're recommending would go towards lead repair and renovation, including ensuring that workers are fully trained on how to do this safely and healthily. $60 million going to environmental threat elimination training programs. $100 million to the Department of Labor for their lead and environmental hazard program, again, to make sure that contractors are not inadvertently causing further problems by contaminating workspaces and work sites. And then $40 million going to the SUNY Community College lead and environmental threat elimination training program, again, to build the workforce that can effectively solve this problem.
Okay, but that $500 million, the big ticket item,
is actually investing.
Landlords applying for that money, or would it be administered in some other way?
This would go through the Division of Housing and Community Renewal and would have a number of different components in order to make sure that the work gets done. We do envision making sure that landlords who are of low or moderate means have resources to be able to complete renovations and repairs to ensure that their buildings are safe and healthy. They often don't have the resources to do the kind of work that's necessary to solve the problem fundamentally.
Okay. And in my last few seconds, I wanted to ask the rest of you about, not to be a broken record, I recognize lead paint is the big cause in major cases of poisoning, but there's a lot of evidence that dust, soil dust, and food are also implicated in sort of lower level. And I just wonder, are we putting all our money into addressing just one piece of this issue, and should we be doing more elsewhere?
Well, and it's unfortunate that I think on the roster of folks who are invited, we don't have some of the key public health people that we've worked with over the years, but hopefully we'll get some testimony from them. I think when we were looking at blood lead levels that were of concern back when they were 30, 20, 15 micrograms, that other sources such as lead in water or soil were considered to be so minuscule in the scheme of things that it was not as much of a concern. As we start to look at a level of concern now, the reference level is now 3.5, the contribution from those other sources becomes more significant. That's for certain. But where that is in which parts of the state is really something we don't know enough about. New York City was recently grappling with, should we do something about soil? Should we do something about the water supply? And the answer was, we just don't really have the data on that yet. But we do know that the lowest hanging fruit, or probably a bad metaphor, but the most readily accessible source is predominantly paint, and predominantly the dust that comes from deteriorating paint on friction surfaces and so forth. And that's why,
Thank you, Mr. Chair.
I would say that's where we need to focus first.
Thank you, Mr. Shashir.
Thank you.
Thank you, Senator May. Senator Ryan.
Thanks for coming, a really nice testimony. I appreciate everything you're saying. I was wondering if you could help me understand, and the folks here, this issue of the lead waiver for insurance. And I'll set the table a little bit. I know if I visit a structure, or if I live in a structure and I fall on a broken stair and I break my leg, the healthcare costs and the damages, the landlord and the insurance companies pay for that. But if I rent a house and my child gets poisoned by lead, you can't sue the landlord for that because there's no insurance in New York State? Could you help me understand this?
Let me take a crack at it. I'm not sure if I can help you understand it, but I can explain it. Before I talked about Mario Cuomo's record, it was somewhat mixed, and it was mixed because his insurance department, before his son combined insurance and banking, the state insurance department started allowing insurers to get waivers to eliminate lead poisoning protection, liability protection in the insurance policies they were offering to landlords. And what does that mean? It means that if you've got a building that's maybe valued at $25,000 and you've got a lead poisoned kid, no one's going to take that case. There's just no resources that comes near the time and effort and the compensation level for the damages. It also means you don't have the insurance industry acting as a pressure and a safeguard to make sure that property owners are reducing risks and the carrier's exposure by taking care of their property. Before you mentioned you've got to get your car inspected every year. If you don't have an inspected car, you'll lose your insurance. If you don't register your car, you'll lose your insurance. Property owners aren't under those pressures, so we lost that check. We used to work with an attorney who had brought lead poisoning cases on behalf of children and their families. And he basically said, you can't bring these suits anymore. 18 years plus 3, the statute of limitations for the child, after the lead waivers started being offered, it basically meant by that, early, mid-2000s, regardless of what happened, private attorneys would look at the case and say, the landlord's got no coverage and the building's worth nothing. So that also means that obviously they're never compensated for their damages, the lifetime of accommodations, their diminished economic prospects in at least some cases, and all the other problems that have befallen them as a result of their exposure to lead because the landlord was negligent.
Yeah, and let me just add to what Mr. Havens said, that when I first got into this back in the 90s, the insurance companies were still in the mix, and they were far to the left of me sometimes on this issue. And then once the exclusions came, they just left the room. So it's an important piece of the puzzle, but it also needs to be coupled, I think, with actual codes that require housing to be made safe.
Thank you. Senator Myrie.
Thank you.
Thank you. Matthew, how do you pronounce your last name?
Shasher.
Shasher, all right, didn't want to butcher it. So can you talk about the negligence standard, what you believe to be as you outlined, I think it's Section D of your testimony, whether the Juarez and, Local Law 1 as enforced and practiced in New York City is something that should be expanded across the state, or whether there are other tort remedies you feel should be made available to tenants as it relates to lead poisoning.
Okay, so the Juarez case, which was 1995, and I submitted a friend of the court brief on behalf of a number of organizations in that case, basically said, in response to the landlord's defense, was, I didn't know there was lead, nobody told me there was lead, said, in New York City, because you have a right to enter the property from time to time to inspect under the city's housing code, and because New York City's local law requires you to eliminate lead hazards, you are on notice of the lead hazards there. Whether or not you inspect it or not, you are on notice. That made an enormous change in New York City, I can tell you. Outside of New York City, that problem has been very difficult. Another case I participated in as a friend of the court was Chapman versus Silver, a 2001 case that took place in Albany, and we managed to push the envelope there enough where the Court of Appeals said, here today in 2001, it's at least a jury question whether a reasonable landlord, if they knew something about there was peeling paint and should have known something today about lead paint, they could be held liable. But it didn't really make much of a change, and I cite one of the post-Chapman cases in my testimony, have still pretty much said, unless you can meet all those elements of notice, and since there's no mandate to inspect, it's pretty impossible to do. It's a very high standard. So I think the way you get at that is you actually have a code, an enforceable standard, to quote Omar Little from The Wire, you've got to have a code. There is no code. That gets us to that point where there is something that puts that onus on an owner to make the dwelling safe. And that's the only way that's going to happen. As I said, the Palace case on the liability of health departments, I cite to that, and if you read what happened in the Palace case, it was the most outrageous, egregious mismanagement by a local health department. And for years before that, the health departments kept saying, well, we're nervous to get involved in this because we could be held liable. And I said, well, you should be held liable if you really screw up. After the Palace case, you could not do worse than that case. And the Court of Appeals said in their decision, we want to protect the health departments. They're not liable. But you can bring litigation against localities for failing to enforce statutory mandates. That's clear. That's what we did for many years in New York City in our class action against New York City to enforce the law. The rest of the state, we don't have any mandates, so there's no way to really carry that out. And lastly, while I have the floor with you, Senator, I just want
Very
to
quickly.
mention about the NYCHA thing, if I may.
Very quickly,
Okay?
sir.
I mean, the situation in NYCHA is a serious situation, but I think we need to focus on where the problem is. According to the data, and I'm looking at it right here from the Health Department, in 2019, the last year
So,
we
sir,
have data.
I believe that Senator Brisport, who is next, is going to ask about NYCHA. So why don't we let him ask his question?
Fine.
And then you have your time without hurry. Senator
Okay.
Brisport.
That was indeed my question. So you have piqued my interest. I'm curious on the topic of NYCHA.
Yeah.
What have you not gotten a chance to say yet?
Okay. So, according to the City Health Department data, there were 3,050 children with lead levels at 5 or greater in 2019. Of those, 76 were in NYCHA buildings. Not only was it a very small number, but the rate of lead poisoning in NYCHA property is much lower than in private rental property. In NYCHA property, it was 4.1 poisonings per thousand. In private housing, it was 11. It's not because NYCHA's a good landlord. We all know NYCHA's a terrible landlord. The reason is there's not a lot of lead paint in NYCHA buildings. The reason is because lead paint was the Cadillac of paints. It was the quality, high-class paint that was applied in the first half of the 20th century. You know, NYCHA didn't put in lots of high-quality materials. There's not a lot of lead paint there. I know it sounds like a dramatic thing because people think public housing is a mess, and it is in a lot of ways. But I think it somewhat diverts attention from where the real problem mostly is, and it's negligent landlords with private housing who don't take care of their housing. So that's what I wanted to just bring out about NYCHA.
Thank you.
Not trying to say it's not a problem, but we need to focus where the problem really is.
Thank you.
Thank you, Senator Brisport. Senator Martucci.
Thank you, Chair. So my question is for Ms. Wilding. I'm very encouraged to hear about the money that you have for the SUNY lead training program. So one of my concerns representing rural counties, one county that is a county without a city, is we've got almost no full-time building departments in any of these places, right? So in many cases, these are part-time folks who are doing compliance, and the county health department, the county to which I'm referring, is one that's not led by a physician, but rather a nurse who's a very capable person and a very hard worker, but she has an extremely small staff. So sort of where does this training program fit in to address those gaps, as we look at the issue in places where there's not full-time or very small full-time health departments, public health departments, and virtually no full-time building or code enforcement departments?
I also live in a county where there are no full-time code enforcement officers, so I'm very familiar with this problem and know that our county health department struggled mightily with the increased responsibilities. So the proposed $60 million that we're proposing here in this broad, bold action would be administered through the Department of Labor to help train lead inspectors, home inspectors, to actually build that up. It's not directly the money that would be necessary to actually boost up county and local code enforcement. I think that comes from other parts of this budget. But it's about making sure that there are training programs to have people be qualified to do that work as there's increased demand for it, and hopefully with this increased funding for them to be brought in.
Excellent. That's great news. Thank you.
Thank you. Senator Clear.
Yes, this question is also for Bobby. In the $500 million, I just wanted to know, was there funding for lead-safe housing?
So in this, in our proposal, the $500 million would be, sorry, I'm trying to get back in Google Docs on a phone, it's aimed at doing the renovation or repairs to make sure that the homes are lead safe, right? So that's really where the focus needs to go, is to actually bringing those into being lead safe spaces and investing in the renovation and repair and painting that's necessary to achieve that.
Right, but I'm talking about, I know, and I had this experience, while that work is being done, is there a place for families to go? Because I actually had a case where my child was even greater poisoned by the work that was being done. repoisoned by the work that was being done. And I think there's a need for families to have a safe place to go while this is taking place.
I think that within that, we could make sure that there's funding for that within that pot of money so that kids are not further poisoned. And I think that the other resources to ensure that work is being done in safe ways is also a critical component of that.
Thank you, Senator. Just one quick thing. It is, I did make a crack earlier about the fact that it was 54 pages, but I make a crack about your testimony that it was 54 pages, but I am very thankful that it is 54 pages. Obviously, it is very thorough. You should also know that we invited 45 folks to take part in today's hearing. 22 will appear in person. 35 of them have actually submitted testimony. So I'm hopeful that some of the stuff that you think might not be said will be in that testimony, and all will be taken into account as we move into the legislative session next year. Thank you all for being here today. Moving to the next panel, which will be Andrew McClellan, President of the Environmental Education Associates, Jim Anderson, Vice President of Citizen Action of New York, and John Adams, County Program Leader for the Cooperative Extension Oneida County. This is the stuff. That's the stuff. That's you see that? You see that? Don't lie. And you do. I'm not going to read it here today. Oh, there's my keys. Mr. McClellan, you may go ahead.
Okay, great. Good morning. Getting close, but good morning and thanks for hosting this event. Let me get my readers on here. New York State is woefully behind other states that have successfully implemented proactive lead poisoning prevention programs. Furthermore, New York State has largely ignored the federal initiative to create lead-safe housing.
Clock. Thank you. Go ahead.
How's it now? To create lead-safe housing and rejected efforts to attract federal assistance to establish an effective lead hazard control program. I'm Andy McClellan, past appointee to the New York State Governor's Advisory Council and President of Environmental Education Associates, a US EPA accredited lead training provider. EEA has trained thousands of individuals in all aspects of hazard control and evaluation, including many New York State and county health department staff. EEA is also a past grantee to the U.S. HUD Office of Healthy Homes and Lead Hazard Control and consultant to many state and local agencies, including the New York City Housing Authority. Industry professionals, advocates, and other stakeholders are frustrated that the state has not taken the necessary steps to ensure that children and other sensitive populations across the state have the minimal protections under federal law. The state has rejected 3 critical EPA provisions under Title X of the Housing Bill of 1992, widely regarded as the federal blueprint for eliminating childhood lead poisoning. Number 1, failing to adopt a licensing and project notification program. Most states and all states with large urban centers and older homes, except New York, have adopted oversight of those who conduct lead evaluation and abatement. EPA funded the startup of many of these states' programs and continues to subsidize several. These programs are fee-based and can generate significant revenues, as is the case of the New York State Department of Labor Asbestos Safety Program. Number 2, failing to recognize the federal definition of abatement under the U.S. EPA Toxic Substances Control Act, TSCA. EPA requires that those who conduct activities in dwellings where children with elevated blood levels have been identified meet the federal standard for abatement. New York State Health Department has not adopted this requirement and failed to advise county health departments and other stakeholders of this requirement. Number 3, the state has failed to adopt or embrace the EPA renovation, repair, and painting rule, which requires that those conducting renovations in pre-1978 target housing or child-occupied facilities attend certification and use lead-safe work practices to ensure that occupants are not exposed to lead hazards during or as the result of renovations. Numerous studies indicate that this adversely affects the well-being of state residents, could negatively impact over 70,000 New York State children per year. New York's failure to embrace the federal initiative has put thousands at risk, including the residents of the New York City Housing Authority, who would have been afforded better protections had the state assumed a leadership role. As it stands now, NYCHA is under the U.S. Attorney's oversight to ensure compliance with federal lead regulations. This has also cost the state and we residents millions in grant funds that are only available to states that adopt the federal program. HUD has distributed $150 to $250 million per year since 1995, and many communities in New York, including Rochester, New York, have used this funding to create infrastructure for successful local lead hazard control programs. The state of New York refuses to take the simple steps to obtain EPA authorization. Many of us have been beating the drum over these concerns for years to no avail. We need your leadership to bring New York State out of the dark ages.
Thank you so much, Mr. McClellan.
Hello, and thank you for inviting me to speak before your committees today. My name is John T. Adams, and I am a program leader at Cornell Cooperative Extension, Oneida County. I've been working upon the issue of childhood lead poisoning in my community of Utica, New York since May of 2010. Currently, I am working in the capacity of an outcome broker for the Green and Healthy Homes Initiative Utica, Oneida County site. A journey to this role included 9 years and 8 months employed as a subcontractor to the Oneida County Health Department's Childhood Lead Poisoning Primary Prevention Program. In my almost decade of service in that capacity, it has become clear that many of New York State's challenges related to the lead poisoning of its children are self-inflicted. It has also become abundantly clear that there are some misunderstandings to the issue of what is a lead-poisoned child and how laws and policies enacted in Albany are actually practiced and implemented throughout the state. To my first point, what consists of a lead-poisoned child? Any level of lead in the body is poisoning. The numbers we throw down on paper and in policy discussions are the basis of a formula. Essentially, whatever the current number from the Centers for Disease Control and Prevention is, means 97.5% of all American children between the ages 1 and 5 are beneath that number. And that for the remaining 2.5% of all American children, they are at or above it. The bigger picture in all of this is a majority of that tiny 2.5% of American children with levels higher than the CDC's reference number call New York State home. Why do we maintain that distinction here? What if only 2.5% of all American kids were HIV positive, but the majority of them lived in New York State? Would you say that's okay and just live with it for decades? If only 2.5% of all American kids were contracting and suffering from COVID-19, and the majority of them lived in New York State, would we be okay with that and just accept it? If only 2.5% of all American kids suffered from depression and suicidal tendencies, and the majority of them lived in New York State, would we be okay with that too? Everyone in this room understands the point that I'm trying to make. The point is, we have told the families and children of this state, we have declared to the rest of the greatest nation on earth that here in New York, protecting the health of children, protecting the potential outcomes of success and happiness, protecting the unrealized economic potential in the lifetime of our children is not a priority. Protecting children from a neurotoxin proven to contribute to a life of crime and recidivism, and protecting children from something that robs them of the attributes the great architect of the universe sought to instill within them is simply not important to the leaders in government of New York State. This state has no process for primary prevention. Everything that is mandated requires a child to be poisoned first. You can do better. You must do better. As a citizen of New York and the father of 3 children, I beg you to do better. To my second point, the implementation of public health code and public health law sanctioned by the state of New York has created a checkerboard across the state. By that, I simply mean that any vagueness of policy or legal mandates allow for too much local interpretation and facilitates a constant distracting discussion about political will among health practitioners and community-based organizations on the front lines of this public health battle. While I am most certainly here to advocate for increased funding to local health departments across the state, the increase in resource allocation should come with amended clarity of what is expected in return.
Thank you, Mr. Adams.
The health of children and their prioritization should not be based on the whims and personalities of commissioners who come and go, and instead the prioritization of these poisoned children should be known to all through the execution of a legislative mandate that leaves no room for incorrect interpretation.
Thank you, Mr. Adams.
Or the receipt of monies for work not performed.
Thank you, Mr. Adams. Thank you, Mr. Adams. Mr. Anderson.
With thanks to Stuart Cousins, Senate Chair Rivera, Senate Chair Kavanaugh, and my home senator, Senator Ryan. Today, I would like to use my time to speak to you about my experiences in my hometown of Buffalo and explain to you what we need from the state in order to end this crisis once and for all. In 2017 alone, about 700 children tested positive for lead poisoning in Erie County. The majority of these children were located in Buffalo's low-income neighborhoods, which are predominantly black and brown communities. According to the Center of Government Research, children who live in predominantly black and Latino neighborhoods in Buffalo are 12 times more likely than children in mostly white neighborhoods to have elevated blood lead level. In a 2017 national report, Reuters found Buffalo to be among the most dangerous lead-hot spots in America. In the Buffalo neighborhoods most impacted by lead contamination, children tested positive for lead poisoning at the rates 8 times higher than the children in Flint, Michigan during the height of their water crisis. Yet, despite these facts that should have spurred immediate and intense intervention by our state government to address a generational assault on black and brown families, there has been no meaningful investment or action to protect the children in Buffalo or other cities in the same situation. I have worked in my community in an attempt to fight this crisis at the local level. With coalition partners, I have fought for funding to remove lead from home, educate parents on the risks they face, and provide treatment services for families with lead-poisoned children. However, this approach does not work. In Buffalo, we continuously face challenges seeing funds that are supposed to be used to address these issues actually make their way into the hands of those who need them. We've been problem with that forever. It is extremely difficult to get answers as to how much money there is, where is it going, and what is the exact steps and timelines are to assure that Buffalo is moving towards becoming a lead-free city. The fact is that Buffalo has dealt with this crisis far too long. Far too many families have suffered across generations with very little progress having been made, placing the burdens on localities to plan, implement, and fund solutions to this crisis doesn't work. The state must no longer absolve itself of the responsibility to solve the crisis once and for all. Today, what I am asking for is the state policy that requires every rental house and unit be tested unless an owner can prove that it has already been tested and is lead-free. We cannot continue to have a system where children are testing strips for lead contamination. I am asking for the state to hold cities and towns responsible when they don't do these inspections and step in and take control when this happens. I am asking the state to include in the budget a large sum of money for cities and towns to use for inspectors and to provide assistance for remediation when needed. The black and brown children of our city and of our state should not be in the population should not be in a population that is deprioritized once again.
1 second, sir. Start my time, please. So that if you have some recommendations there at the end, I wanted to make sure that you got time to. So, did you have any more recommendations? You said, obviously, you were specific about more money and lead prevention programs. Were there any other recommendations that you had at the end of your testimony right there?
Well, the only observation is that the legislature has failed to act on this. Mm-hmm. The fact that it seems as though that the action that is coming now is only because more money is coming now. So if the more money that is coming now is going to move the legislature to act, what were we looking at before the more money, before we address this problem? Why do we keep coming back to this? The hometowns that all of you probably leave, many of you, you know this problem, it exists. It should have been number one. I go back when Deputy Speaker Arthur O'Ebe was up here and brought this issue up in the 90s.
Wow.
We were then working with the Environmental Education Associates to train people up in the communities that are affected to try and deal and help. We've been trying at community level.
Yeah.
The state has not done enough.
Thank you, Mr. Anderson. Mr. Adams, I'll do the same for you. I'll do the same for you. You had some recommendations near the end of your testimony, and I cut you off, but it's only because since we have a long day, I wanted to make sure that we skip it on time. So if you have some final recommendations, can you hear me?
To be honest, I am hearing impaired, and the masks make it very difficult.
Gotcha. So I will speak a little bit louder. Is that a little bit better for you, sir? So I interrupted you near the end of your testimony because it's a long day, so I wanted to make sure that we kept it moving. However, the question I have for you is, do you have some final recommendations at the end of your testimony that you did not get to share while you did your testimony at the...
Yes.
Please read that into the record, sir.
Okay. Well, I'm going to finish up the original piece of my testimony,
Go ahead.
Which is simply this. Much of the testimony you will hear today will be filled with great examples of how we can do better with fighting and preventing this disease among our children. As we now recognize the importance of public health, as we now realize that the practitioners of public health are heroes and they're fighting to protect us, listen to what these fighters are asking you for. We are ready to fight and win this battle, but we need you to give us the weapons and policies needed to construct the plans, implement the designs, and deliver a resounding victory against lead poisoning for the children of New York State. I know you will do the right thing for the right reasons. May the great architect in the universe bless you, and may the great architect watch over and bless New York State. My recommendation is, first and foremost, is understanding that it's a good talking point to say we have a primary prevention program here in the state. When I was working in that program, we were addressing primary prevention for children who were testing anywhere between 1 and 14.9. Today, if the kid came in with a 7, the CDC and the state of New York rightfully indicate that that person is poisoned. We can't not do anything anymore. We can't use funds for an issue. And the thing that I always think about on this too is understand that when you are doing these changes and you're giving the money, you're also creating more housing ready for electrification, thermal envelope development, air source and ground source heat pumps, energy efficiency work. Also realize that when you are not allowing all these children to get poisoned, you're getting a return on your economic investment, which is certainly more provable than a tax drop, okay? And the other thing is too is you're gonna create more children who can escape childhood with their intelligence intact. Future Elon Musk, future Albert Einsteins lost to dust in our inner cities because we didn't want to do something. My recommendation would be an inspection prior to housing policy in some way to make sure enforcement of anything that you do is not left to the whims of local communities where political will isn't always exactly the right thing, because politics and doing the right thing are not the same thing.
That's right.
Thank you, Mr. Adams. Senator May.
Yeah, thank you. And Mr. Adams, I don't know if you can hear me, but I also represent part of Oneida County. You talk about the need for clarity, for statewide norms, and not leaving it up to local discretion. But I wonder if what you've heard today, if you think we need different approaches or standards in an area of the state where kids live in single-family, two-family houses, rather than high-rise apartment buildings. Are there different kinds of approaches or standards that we should be setting?
Well, thank you, Senator May, and I recognize the good work you do in representing the western portion of Oneida County in your district, and I thank you for that. You know, there's two things that I have been looking at, particularly when I do some data analysis, which, you know, right now, again, data is a huge problem. If you want to look at data on a county-by-county comparison, you have to look at aggregate data that was just released this year that encompasses 2016 to 2018. So we're looking at the past. We're looking at a past of numbers that doesn't even indicate our current action levels that are set by the New York State Department of Health. So it's tough to do anything with current data, right? You want real-time data. If I was a general in a battle, I would want to know exactly what's happening now, not what the field looked like 5-6 years ago. But one of the things I found most interesting that was almost kind of a pilot in the COVID response is that you could take regional approaches. We use the Regional Economic Development Council regions for NYSERDA. We use them for COVID-19. We use them for economic development. And when you actually look at those groupings, you see that there are particular groupings and regions, if you will, throughout the state that have an outsized problem. The Mohawk Valley region, for example, of those 6 counties, up until this past year, all 6 of them were always in the top 25th quartile of worst incident rates in the county. It would seem that if you have a region that is got quite an outlier average, then maybe taking a regional approach is the way to go. The other thing is, too, is if you group a bunch of counties in together, it might be harder for one health commissioner not to go along with all the other health commissioners or state regional offices are doing. For example, Herkimer, Fulton, and Montgomery don't have their own full-service health departments at a county level. They're serviced directly by the New York State Department of Health. So I think being open to a lot of things is important. I definitely agree with the fact that there are hot spots throughout this county, but it's all based on economies of scale. A child poisoned is a child poisoned.
Thank you.
Okay, you're finished. Okay, so I'll step in here. Great. So first of all, just to address to Mr. Anderson, I think, we've had a lot of testimony this morning about, policy changes and all that, but I think the sort of intensity of your charge to the legislature is really important. I think I think a lot of us are both aware of the dire conditions of housing and the huge impact it has on people, and share your anger about, I think the last time the legislature had a hearing on this topic was 1994, and it has been an ongoing problem. What we're doing today is not, I mentioned at the beginning, we're hopeful now that there's enormous federal resources that we can deploy those resources effectively, but what we're doing today is not a response to that. We have been working on legislation for the past year. There's a bill called the Lead-Free Homes Act that I had introduced in May that we're working with some of the folks testifying today to sort of strengthen and bring forth in the session. And just to say, I share your commitment and the commitment of many people who testified today to really finally absolutely addressing this on a statewide basis and really going for a state that is truly free of lead poisoning. And I've had an opportunity to work with your organization pretty extensively on preparing for that effort as well. I want to focus my questions now for this panel, given the limited time we have, just on Mr. McClellan's testimony, because you've raised an issue I think that hasn't been fully kind of explored today by other testimony, which is this issue of the EPA standards from the 1992 legislation and the way the federal government recommends and other states have addressed the issue of the qualifications of people who do this lead work and the standards that they should be meeting. Can you just talk a little bit more about how New York's approach compares to other places and the significance of trying to implement those standards here in New York?
Well, the EPA under Title 10 created this infrastructure for lead hazard control that included licensing and certification for all the folks that will get involved in lead-safe work practices, and they made that available to the states. 24 states that to this point have adopted it, the large urban ones. In the states that didn't adopt it, the EPA takes responsibility for it. So actually, there is a New York State program. It's run out of Edison, New Jersey. And that's where the enforcement of the EPA requirements comes from. There's no such enforcement done out of Albany or anywhere else. Now, the cities, New York enforces that under local law 1, and some of the other local governments will adopt those requirements too, as a condition of the local rules. The state has no role in enforcement whatsoever.
Do you, you've had these conversations, you've previously been appointed by the governor to the advisory board. Do you have a sense of what the calculation there has been in New York State? Why has New York State not adopted these standards?
It's an absolute mystery to me. It's there must be some magic someplace, because it makes so much sense to just drop a quarter and call up EPA or call HUD. A lot of the answers that we're struggling with already exist. There's a wonderful publication, first created in 1992, reissued in 2012, called the Guidelines for the Evaluation and Control of Lead-Based Paint Hazards in Housing. It's about 500 pages, double-sided. All you got to do is read it. All the answers are in, and the mechanisms for starting the process aren't in there. And some of the things that you guys are talking about.
Sir, make sure
Senator
that
Ryan's
you
idea,
put your
wonderful.
mask, that you keep your mask over your
Sorry about
nose
that.
as well.
I'm always getting yelled at. But, so the mechanisms for getting that started, they need to happen. And then the state has to adopt the program. But those resources are there. I mean, New York is the North Korea of lead.
Wow.
It is. We don't know we don't know how bad it is until you leave. And you go to a place like, Pennsylvania or Jersey or Massachusetts, where they have this infrastructure that exists.
Well, again, I think we're going to fix that. But you want to go back to?
That's right. Thank you, Senator Kavanaugh. Senator Ryan.
Well, thanks, everyone, for coming up, especially folks from my area, Jim and Andy, and I know you've been doing this work for a tremendously long period of time. I just wanted to touch a little bit on housing conditions in Buffalo, because I think sometimes we get an idea of what housing looks like. So in a place like Buffalo, where most people live in two-family houses, there's no inspections ever take place. Only if you live in a multiple dwelling or three or more, they have to have a periodic inspection. But most doubles in Buffalo have never had an inspector walk through. And I know, Andy, you do a lot of inspections in houses, but if you can just give it or Jim, an idea of your impression of what sort of a typical two-family house being rented to a low-income person looks like.
Well, yeah, as you said earlier, these buildings were built in the 20s and the 30s, and so they're showing their age, okay? A lot of folks do a very good job of trying to keep them up, but it's hard when you've got that many things going on to keep the houses up. So there's never an instance where we don't find some deteriorated paint, okay? When we look at these houses, it's the expectation. Now, there's a difference between deteriorated paint, or there's a difference between the presence of lead-based paint, deteriorated paint, and dust, okay? So the issue really isn't the lead paint. The issue is the dust, or the condition of the paint. So that's what we have to go after. And, in tenant-based rental housing, the tenant isn't in a position to rectify the situation. They're relying on a landlord. They might not have the skills to do that. They might not have the desire. So housing and rental housing is always in worse condition than owner-occupied housing. And there's a lot of doubles, lots and lots of doubles in Buffalo where you see that happen, and where we've seen it for 25 years.
You have anything on that, Jim?
No, the only thing I would say is, look, I'm a combat veteran of Vietnam. I know what the agents that were used at that time have done and how slow the response is. I'm also a combat person around this issue of lead in our community. And I know how long we've been begging. I know the people who are affected by the fines and the fees on their houses cannot resolve it. And I don't mean to be heavy on you guys, you ladies and guys, but I do mean to tell you that the cry from the community is you must do something, and it must be done in this 2022 budget. We cannot have another budget go through without this issue being addressed, and you have the ability to do it.
Thank you so much, Mr. Anderson. Senator Clear.
I just want to thank you for your testimony, all of you. It's absolutely correct, and for pointing out that it really is poorly maintained lead paint that is the threat to housing. I wanted to ask, I'm sorry, you made the recommendation, John Adams.
Yes.
You made the recommendation, inspection prior to housing. And I'm just reading the Kavanaugh-Rivera bill, 2142A, point of sale plain lead disclosure. Does this suffice, or is there something additional? I haven't read the bill, so I don't know. I'm just looking at it now. Is what you're asking for contained in this, or is this, does it require more?
Right, well, what I'm asking for is the understanding that the process to check a house out and ensure that the conditioned living space has intact paint and collecting up to about 10 dust wipes and making sure that they're coming in underneath the current levels that are set by EPA and HUD is not expensive, is not time-consuming, and is something that can be done by fire department technicians going in to do 1203 inspections, is something that codes officers can do when they're there on a complaint, is something that health department people can go in and check out. You're not going to have an army of 500,000 risk assessors out there doing all these inspections. But you can have 20 people who know how to do a visual inspection, have some sort of an accreditation, have taken the class to collect the dust wipe properly, and then have one risk assessor back at the office doing the roles that they're allowed to do as far as assessing the dust wipes, making the determination if that house is ready for human occupation, or saying, guess what? Before, when you used to make the health department come to your house 8 times over 6 months to take dust wipes because you didn't feel like cleaning, well, guess what? They're gonna come once, and then you can pay for somebody else to come here at $600 a pop and have your house inspected the other 7 times. We know that when you put the burden back on the property owner, they actually pick up the HEPA-vac and use the wet cleaning like they're supposed to, because $600 a visit from a risk assessment firm is great for Andy, but it's not good for the bottom line of the property owner.
Thank you.
Well, the truth is what Andy does helps those who are affected in these communities become part of helping to get it fixed up as best as they can. If they can if they can be trained to do the testing that our cities and our counties won't do, I say that's a plus, and an investment worth putting more money into. It's about creating jobs for people who care who will do it, rather than jobs for people who just in it to make money.
Thank you.
Thank you, Senator Clear. Thank you all for being here. It is indeed part of the mission of these folks that are up here to make sure that the 2022 looks different as far as the budget. And I hope that, and I know that the administration, who now actually listens, is listening. So hopefully they hear us. Thank you so much, gentlemen.
Thank you all.
Next panel will be Paul Webster, co-leader, policy director of Lead-Free Kids New York, and Jessica Caroline Williams, program manager for Lead-Free Mohawk Valley. It looks like you can go ahead and start, ma'am. Hopefully, I'll ask for Paul Webster when you're done. Go ahead, ma'am.
Hopefully you can all hear me. Thank you for your interest in learning more about the state of childhood lead poisoning in New York State. My name is Jessica Caroline Williams. I'm the program manager for the Lead-Free Mohawk Valley Initiative through the Utica Neighborhood Housing Services in Utica, New York. Currently, about 18 municipalities in New York State have HUD lead hazard reduction or lead hazard control grants, receiving about $65 million in federal funding over the past 3 years. This funding is intended to serve those households with the highest risk of poisoning children, and specifically prioritizes housing that have elevated blood lead levels in children. It is our understanding that there are hundreds of open lead poisoning cases for the health department that the $5.4 million Utica lead grant serves. And to date, there have only been 3 properties that have been enrolled as part of the health department's environmental follow-up, because staff cannot directly share related data with housing agencies. The current New York public health law that directs the New York State Department of Health's Child Blood Lead Level Registry, LeadWeb, does not explicitly allow blood lead levels or property addresses to be shared with entities delivering lead prevention programs, including HUD lead grants. It was legislative, not judicial or executive branch, that created this statute, And you as legislators have the ability to amend the law to explicitly allow sharing of blood lead levels, property addresses, and other data held within LeadWeb with entities outside of the health department that are conducting lead prevention programs. HIPAA allows this type of data sharing. It is the state law that prevents New York State Department of Health from sharing that data. We know there are concerns about confidentiality. Data becomes de-identified once combined with those properties that enter lead prevention programs through open enrollment. Amending this statute does not have any budget implications since data already exists and would not be overbearing to staff to provide. Specifically, this lack of data sharing is hindering the ability of New York communities to meet the intent of these federal funding streams that bring in millions of dollars in outside funding to stay competitive with other regions and states. Thank you.
Thank you, ma'am. Mr. Webster?
Yes, good afternoon to the chairman, members of the State Senate, leaders, staff, and those gathered here today to participate in this most important policy discussion regarding the scourge of childhood lead poisoning in New York State. I join with our allies in thanking and commending the chairman for convening today's hearing and your ongoing efforts to draw attention to this unfortunate, preventable, and deadly environmental public health threat that our coalition currently estimates impacts the lives of more than 100,000 children here in the Empire State. I'm Paul Webster, Policy Director of Clean and Healthy New York and co-leader of the Lead-Free Kids New York Coalition. I'm a lifelong New Yorker, educator, activist, and for 25 years, landlord here in the city of Albany. And I, always try to inform tenants about the possibility of lead being present and do everything I can to take proper maintenance steps to upkeep my building. But across New York, that's not always the case, and that many children are being sickened because of inaction or neglect by landlords and reluctance by state leaders to take action in several critically important and legally mandated areas. To this point in today's hearings, we've heard from state agencies, medical experts, advocates, and affected persons on the best ways to protect New York's children from the irreversible damage that is caused by the ingestion of lead, leading to the impairment of their abilities to think, learn, and concentrate. You have also heard about our support as the Lead-Free Kids New York Coalition in advocating for 4 bills to address the issue of lead poisoning, and they were introduced this year to deal with it. And the first is Bill S2122A Rivera, the lead in school drinking water, S2142A Kavanaugh, the point of sale paint lead disclosure, S6554 Bailey, the renovation, repair, and painting, and S3079 Ryan, the landlord insurance for lead-based paint. The Rivera-Gottfried bill, the first bill I mentioned, passed both houses, and it expands and strengthens the state's work to eliminate lead contamination in drinking water for all of New York's school buildings. It's our hope that Governor Kathy Hochul signs the bill into law in the coming days, and the other bills have our continued support as we expect to see these bills taken up early in the 2022 session. A half century after New York banned the sale of lead-based paint, we're still finding that is the primary cause for lead poisoning in New York. Children after they ingest dust and particles from older, poorly maintained residents. 50 years after the legislature and governor took action originally, not enough has been done in the intervening decades to eliminate lead hazards before children are harmed. And as Jim Anderson mentioned, the last time the Senate did a hearing on this was May of 1994, led by Senator John Daley. And I was one of the legislative staff here that day, and we're almost 30 years later, and no action has been taken. Last week, our coalition sent a letter to Governor Kathy Hochul outlining our call for a $1 billion New York State lead poisoning elimination project. This project relies on recently obtained $12.7 billion in the Federal American Rescue Plan Act and the American Recovery Act dollars, and the $15 billion that Senator Chuck Schumer mentioned was here, did a press conference with last week on the Drinking Water State Revolving Fund. In closing, we've got to do more to ensure that our homes are free from lead and that we have lead removed through lead-based paint hazard abatement. Greater efforts must be put into involving and encouraging landlords to improve their properties, and more needs to be done to support mitigation and repair actions of low and moderate income property owners, a constituency who do not have immediate access to financial resources to eliminate or reduce lead hazards. Thank you.
Thank you, Mr. Webster. We are good. Thank you so much for your testimony today.
Thank you.
Next panel is a panel that I'm really looking forward to. You're joined by Ms. Tisha Jones, president of NYCHA Bailey Houses, and a constituent of mine. I hope that she's here. Is Tisha here? I hope she's coming. We're also joined by Erland Kimmich, membership coordinator for Grassroots Action New York, Oceana Fair, Southside branch leader from Families for Lead Freedom Now, and I believe she is a constituent of Senator Mannion, as well as Gabriel Burton Hill from the Newburgh Clean Water Project. And before we begin, I'll take the privilege of the chair to actually point out. Hello, Ms. Jones. How are you? It is the type of. So I've been a legislator for 11 years, but some of the legislation that I'm most proud of is a direct result of impacted folks approaching me and my staff about things that we need to do legislatively. And one of the people who did that a few years ago was Ms. Tisha Jones. I'm sure she'll talk about her situation, but I just wanted to welcome her back to the Bronx. I'm sorry, to Albany, as she's been here as my woman of distinction in years past, but somebody that I hold in high regard as a community leader, and somebody who definitely has directed my legislative attention. And I know that some of the folks here who are community leaders in their own right have done the same for legislators and leaders in their backyard. So we'll just kick it off. Ms. Jones, mic is yours.
Good morning, senators, stakeholders, and all New Yorkers. My name is Tisha Jones. Unfortunately, I know all too well what elevated blood levels can do to children. As a mother or as a parent, you want to protect your children at all costs. Unbeknownst, protecting my then 4-year-old from lead poisoning would be a challenge. I did not know what to do, whom to turn to, or how it was going to affect my child. I was helpless. As a parent, you never want to feel helpless. No support from my elders, community, or health professionals. Living in New York City Housing Authority, also known as NYCHA, there were necessary compliance with state and federal guidelines, in which families living in NYCHA with younger children received literature about lead poisoning. The literature also included reassurance there was no lead-based paint used in any dwellings after the 1970s. It also stated dwellings were free of lead, and I believed them. As we all have experienced the battle with the world's unseen enemy, COVID, lead poisoning definitively have affected more children than the past. Dwellings that were already in deplorable conditions were not addressed during the stay-at-home mandate. Parents were unskilled doctors, teachers, maintenance workers, etc., while the city's future was potentially at risk being poisoned with lead, while parents were trying to protect their families from COVID. The Department of Education has also failed these children, allowing them to fall through the cracks. Children with elevated blood lead levels have individual education plans, also known as IEPs. The state of New York education system did not and has not taken this into consideration. I stand before you as every parent in New York State looking for an innovative approach in awareness and prevention of lead poisoning. There are so many factors to include: the Department of Education, the central-based system utilized in the healthcare system, social media platforms, and environmental justices. I ask that we all as New Yorkers take this into consideration as we move forward to eradicate lead poisoning with an innovative approach.
Thank you, Ms. Jones. Ms. Hill.
Greetings.
there was no way I could put everything that I wanted to say.
Please make sure that's a mic. Could you lend the lady your mic, please? Yep.
Greetings and thank you for this opportunity to be here. As my testimony states, in 1997, I became a first-time mother, and I was very thrilled and excited about being a mom, and priority is the safety and well-being of our children. Couple of years later, I was returning back to the workforce, and my daycare facility required a lead test. Thankfully, that was the only way I know that my daughter actually had lead, because it goes undetectable. Her lead result was 42, 45 being fatality. So I was called by my local Orange County Department of Health to immediately take my daughter to St. Luke's Hospital, and if I wasn't able to get her there right away, they would send police to my home to escort me there. Once arriving to the hospital, she was immediately admitted, scooped out of my arms, and taken into a room. And from there, I was explained that I was told that she would need chelation. I had no idea what that was. I'm a product of the 60s. I'm sure I had lead in my system at some point, but I was never tested. But chelation is a treatment in which the metals, there's a fluid or something they put in, and the metals stick to it in order to wash it out of your urine. So I didn't know that my 2-year-old baby, which is her mom, this is my granddaughter, would need an IV for 7 days around the clock. Wow. Imagine trying to keep a 2-year-old still for 7 minutes, let alone 7 days around the clock. But somehow we got through it. I was staying at the hospital overnight, and then also, to a point that was made earlier, there was funding for lead-safe housing. So we were not allowed to go back to the house, which is very emotionally disturbing, but we had a safe place to go. And during that time, we were able to accumulate and save money to move into a new place. And yes, they followed my child. The Orange County Department of Health followed my child for a number of years. Anytime I moved, I needed to report, which I was happy to do so because I wanted to make sure that she was safe. So I was glad that that policy was in place, that I did have someone to call, unlike you. But that lead-safe housing gave us stability, but it also gave us emotional and mental support that we needed during this transition. And I just want to add that, yeah, there's a lot of emphasis put on lead paint, and there needs to be, but there's also lead in our water. I live in a very old city, and the infrastructure is in desperate need of repair and replacement. We did have a lead replacement grant that homeowners could apply for to have their pipes replaced, but it was overwhelming. There was not enough funding. Probably 15 or 20% of the people that applied actually received the money to do so. It's almost $10,000 to have those lines replaced. But then if the lead is coming from the infrastructure of the city, my new municipality, into my clean pipes, like, is there any risk there? So it needs to be eradicated from the source. I'm not going to take up much more time, but everything that I've heard here today really struck me as vitally important. I couldn't have said it more. So just as a mom and a grandmother, I urge you to really pass this through. My daughter is 24 now. My grandchild is 5. Do we really want her coming back here 20 years from now, asking for the same thing?
We do not,
And
madam.
we didn't talk about the miscarriages, birth defects that can happen, when a mom is carrying a child. We've never had a birth defect in our family. She's the first. And I wonder, does it have anything to do with the lead?
Right.
Our children are very sad, depressed, bipolar. Does that have anything to do with the lead? So I urge you to make this happen.
Thank you, ma'am. Go ahead, Ms. Fair.
Greetings, Chairman Rivera, Chairman Kavanaugh, and members of both committees. I am Oceana Fair. I live on the south side of Syracuse. I am a mother and a grandmother. I worked 15 years as a traveling nurse in central New York. I am a woman of color, a civic leader, and someone whose family is directly affected by childhood lead poisoning. Yes, there are lifespan consequences from childhood lead poisoning. In about 1982, my parents were renting when my brother Bobby, now 41, was severely lead poisoned. Since then, family has assisted him with cooking, bathing, and daily activities. He was robbed of his future at the young age of 2. In my family, this environmental disease has become generational. My granddaughter was recently lead poisoned in my home when we were renting the property. The landlord never addressed nor informed us of the lead hazards present. We know childhood lead poisoning disproportionately harms families of color. However, our voices are disproportionately absent from the discussion and design of policy responses. Those of us closest to the problem have been furthest from the power to solve it, but these challenges shouldn't and won't stop us. Let me share my personal response. First, to see that boys and girls who grow up with my grandchildren's children do not have to face this devastating disease, because it is completely preventable. Second, I am an elected leader of a community group, Families for Lead Freedom Now. I am one of 5 members, and I am here also on behalf of my co-leaders, Mr. Gabriel, Mr. Ferruzzi, Ms. Bonfrida, and Ms. Darlene. We bring moral and spiritual resources to bear upon this problem. Now let me share what we have heard from parents and others this past summer at our first ever People's Public Hearing, Environmental Justice for Syracuse Now. Our own Common Council President, the Honorable Heather Hudson, said her son was lead poisoned in her home when she was a new mother and homeowner. The seller never disclosed the presence of lead hazards. New York Civil Liberties Union's Lanessa Chaplin described a double impact upon our families. 1, we aren't wealthy enough to escape landlords who lease rundown housing, and 2, there's no public campaign massive enough to help us check lead poisoning at the porch steps. The new American mother testified to the pain of coming to America with promise of peace to discover that our government can't prevent refugee children from suffering lead poisoning. Our local anthropologist, Sandra D. Lane, told us even some of our local medical professionals think lead poisoning is a thing of the past. Finally, let's consider the upcoming necessary demolition of the 1.5 miles of Interstate 81 viaduct. I-81's peeling bridge paint may have far higher lead concentration than the house paint that is already harming our children. Will the contractor protect our children in nearby public housing from the toxic bridge dust paint? Will workers be protected from lead dust and bringing that contamination back into their homes? The time to invest in the health of the generation and generations to come is now. Thank you for this opportunity to testify.
Thank you for being here, Ms. Fair.
Hi, my name's Erland Kimmick. Grateful to the senators for asking me to come up here and share basically the story. I'm a RRP, so renovation, repair, and painting certified lead remodeling person, worker in New York City. And I've experienced firsthand the lackluster enforcement mechanisms at the city and state level to hold workers like myself and who work under pressure, sometimes not trained or anything like that, in order to get work done. And a lot of times some of us don't feel personal responsibility towards the public safety and keeping people safe. So from November 2012 until May 2013, there was a hallway renovation in the building that I lived in, a residential co-op, 362-unit building. And the work included removing wallpaper and scraping and sanding surfaces, including door trim. My wife and I and some of the other neighbors in the building were concerned about lead contamination. The contractor was in no compliance with EPA regulations around lead. The construction created dust and paint chips on the common passageway floors, and there was no distribution of the lead paint informational pamphlets. The Renovate Right pamphlet, which is simple, it's brief, it's not 500 pages, but it's an informational pamphlet that tells families how to protect themselves from lead. Simple, real simple stuff that you can protect yourself and your family. But those were never passed out the way they're supposed to be passed out in this kind of a situation. Entry doors to apartments were not taped. Plastic was not draped as catchments for paint, for chips and dust. Daily cleanup was lousy, and proper HEPA vacuums only brought on site after we made some noise and filed complaints with 311 and the co-op board. Even the building ventilation registers in the hallways were not covered. The work proceeded in this 16-story building, home to some children under 6, and in phases in 2 or 3 hallways at a time. And the residents of the building, we decided to test for lead ourselves with the EPA test kits that you can get at the hardware store for cheap. And we found lead to be present on surfaces exposed as they were removing wallpaper. We relayed these results to the co-op board and the contractor, and they brought in an independent lead testing company. That tester also found lead in some of the wall surfaces being disturbed and in the door frames. The board posted a notice of the findings with a brief statement which basically reassured residents that the contractor was lead certified and that measures were being taken to minimize the lead hazard. We urged the board to demand the contractor distribute the pamphlet to residents so that people, especially families with young kids, could safeguard their apartments as recommended by the EPA. You know, wipe your shoes and stuff like that. Take real basic, simple measures, but you know, clean your pet's paws when they're coming in. Okay, and out of desperation, we called EPA and asked them to investigate the building for lead exposure. The agency was unable to send inspectors at the time. The work was being done, informed us that they had to be present as the lead was being disturbed and falling from the workers' tools in order for the inspection to be valid. Getting them to come out to the building required phone calls, faxes, and emails. The EPA told us they only had 3 inspectors to address complaints and inspection requests in New York City. And as the work progressed and no actions were taken, the contractors' work practices and protection efforts got worse instead of better. The experience was frustrating and clearly dangerous. How many of our neighbors were taking precautions? I don't know. How many people got sick? I don't know.
1 second,
And-
Mr. Kimmick. Mr. Kimmick?
Yeah.
1 second. My time, please. So if you have, I know that you're nearing the end of your testimony. Was there any recommendation that you had towards the end of it as you were finishing up?
I think there's some laws in place, but there's the enforcement. There's no enforcement. If you go to EPA website now, the New York State is with the Virgin Islands, Puerto Rico, and New Jersey, and there's one email address that you can reach out to. There's no phone number, there's nothing, it's an email address, and the whole process takes a long time. They don't have enough inspectors.
This is at the federal level, you're saying?
This is on a federal level. There's nothing with the state, there's nothing with the city. Everything 311 directs you to the EPA.
So certainly the need for resources at the state level to be able to inspect, and we've been hearing quite a bit about that today, and the need for the enforcement and the mandate that there be inspections in homes. That's
Absolutely, absolutely. It's necessary. The state, I think, has to step in. The national, they don't have enough inspectors.
Thank you for that, sir. And Tisha, one quick thing I want to ask you. I'm obviously very familiar with your story, but do you have a sense about, and a lot of it has to do with we've talked about NYCHA. I'm sure that you've been here, you've heard some of the conversations that have happened about NYCHA. But do you have any thoughts about the role that the Department of Education could play in this? Because I know that we've talked about that before, like some ideas that you might have on that regard.
Well, normally, when a child has an IEP, for instance, right, they might get like extra time taking their tests and so forth like that. But it's a little different with children that have lead poisoning, especially at an elevated level, 9 times or 8 times, right, that they have brain damage. So a child with an IEP that might have like ADHD or something like that, it's a total difference. So it needs to be something structured that will help them to ensure that they will graduate from school. Mm-hmm. So we have like a policy now where you can graduate up to the age of 21. I think if a child has lead poisoning, maybe it should go up to the age of 23 or 25 due to the fact that they've had brain damage. So when I say there should be a centralized base system, like how the hospital uses, like now with COVID or with your children with shots. If I go to if I go to Lincoln, they can look it up and see that my child has had shots. That should be intertwined with the Department of Education and the Department of Health for the children when they get into these schools, so that they know how they need to service these children and what services that they need. Recently, after I found out about Dakota with the lead, the school sent home a notice stating that
Dakota is your daughter?
yes. That the school, it was found lead in the water, and that they went to certain water fountains and closed those water fountains down so the children can drink out of them. So I said to myself, and I went down to the school and I said, well, what about the children that were here since pre-kindergarten that accessed these water fountains? And they drank from them for 7 years because the school goes up to 6th grade. So they don't meet the criteria to go and get tested, although they could have elevated blood lead levels. But they're really focusing on ages 1 to 2. I know myself as a parent, I did that at age 1 and 2. But they don't explain to you what lead is. Or you just see the immunization card and it says lead test, but it doesn't go any further. It wasn't until my child went to another physician and they wanted to do the test for themselves that I found out. But suppose I stayed at that hospital, I would have never known. And I just would have thought, well, maybe my child has a learning disability. And that wasn't the case at all. So when it comes to like landlords and stuff like that, and I heard what one of the gentlemen that were up here on the panel, he said he didn't think that NYCHA had a really severe problem. And I'm not going to discredit anything from anyone upstate in New York, because clearly you guys have a lot. You have the soil, you have your homes, and then you also have the air, which a lot of people did not include. Because you got to remember, jet fuel was used all the way up until 1997. That's still in the air. That's only 24 years old. They're still breathing this. So you're walking on it, you're breathing it, and you're eating it. So how can you, we want to tackle it in the home, right? You can tackle it in the home when they get outside the home. What happens then? So we need to find a way environmentally that will stop the lead as well.
And these conversations are part of that. And I just want to again say for the record, thank you for your continued education of me on this issue. And please say hi to your daughter, Dakota.
Okay, I will.
Senator May.
Yeah, thank you, Ms. Fair. Welcome. I'm happy to see you here from Syracuse, and really grateful for the amazing, fierce advocacy you do for children and parents in our part of the state, but all across the state. Couple questions. First of all, thanks for your comments about I-81 and the construction process, and I hope you'll bring that, come to my office and we can talk, because I'm on the EPA's Local Government Advisory Council Committee on Healthy Communities, and this is exactly the kind of thing we need to be talking about there. But I have two questions for you. One is about how Syracuse, with its lead ordinance, how does it carry out inspections?
So even though we passed a lead ordinance back in 2018, 2019, I may be off, our lead ordinance has yet to be enforced. Nobody's enforcing it. Our code enforcement inspectors are not trained to do it. We have not been given a clear answer as to when they are going to be up to par to do it. They keep giving us COVID as an excuse, but right now they're not trained. We have a rental registry that has extreme low compliance, and that's what they're using to generate these inspections for lead. So right now, unless a tenant calls to complain, or unless a child tests positive in the home and then the county comes out, they're not being done.
Okay. Thank you. And also, I saw you nodding along as people were talking about the soil issue, soil contamination. Can you talk about your experience with soil contamination?
Yes, so when we found the lead contamination in my home and my granddaughter was lead poisoned, our entire drip line from the peeling paint on the outside of the home, all of the soil was contaminated. So the county health department came out, they found the high levels of contamination, and then that burden was left on us to figure out. So even though HUD sent money to remediate the lead paint in the home, the soil was left up to us as a homeowner to figure out. And ours was a unique situation because we were renters that then bought the home from the land bank and remediated to keep our children safe. So we had to do landscaping ourselves. Then recently, the National Grid sent out crews to replace our natural gas lines. That crew dug up the soil in my drip line, dumped it into my driveway, on the driveway, not on plastic. And yes, they replaced the soil. However, when they dumped that soil into my driveway, they then contaminated the driveway where my 2-year-old granddaughter plays. So now we spent the rest of the summer making sure that that all got cleaned down, re-landscaping where they tore up, and trying to keep that area safe.
So what I'm hearing you say is we not only need better training for the inspectors and presumably for people who are going to do the work, but all the way down to places like National Grid or anybody who's doing work
Yes,
on the land.
Yes,
around
if
our
utility companies are going to be coming into areas like ours where we know these drip lines are contaminated and digging that soil up, they need to be taking precautions. Simply laying down a plastic tarp would have prevented the contamination in my driveway and re-exposing my grandchildren to lead paint this summer.
Thank you, Senator May.
Thank you.
Senator Mannion.
Thank you. Thank you, all of you, for your courage in coming here today and sharing your stories, some of them for a long period of time. And Oceana, Ms. Fair, thank you for coming and testifying and giving the Syracuse perspective here. I have a couple questions. I'm going to start with your comment about the land bank, and of course we know what the land bank does for our area, and you know, we're all very supportive. But was there, when that transfer occurred, was there any testing or documentation related to lead as a part of that procedure?
No, the only thing we got from the land bank was a basic postcard that said, your home is being taken from the landlord, stop paying your rent to the landlord, and that the land bank now has possession of the home. We then spent the next several months negotiating with the land bank what was going to be done with the property. During that time is when my granddaughter became lead poisoned. So the previous owner never disclosed it to me. The land bank never did anything to test. The only testing was that she had tested positive at 17.1 and the health department coming out and then proceeding to do their test. The other problem became then if the land bank had used the HUD funding to remediate the home, I would have had to pay back that grant plus the price of the home. So we then needed to speed up the purchase of the home, even though I would have otherwise qualified for that HUD funding so that I could become the homeowner, apply for the HUD funding, and get the home remediated. This stretched our remediation out into a almost 3-year process. So for 3 years, the kids were still being exposed. We had to take extra measures to make sure that we kept the house safe for them.
Thank you for providing that answer. And I almost asked a different question, but I'm glad that I asked that one. In your experience going all the way from your brother to your granddaughter, is there anything from a school perspective, codes perspective, medical perspective, landlord, that stands out as a major difference, or is there anything that we are still doing things the way that when your brother was impacted by this, or even worse than back then?
Unfortunately, we're still fighting the same battle. Nothing has changed. Like the parent who already pointed out about the IEP, I, being a nurse, also talked to our local school union that has school nurses on it. Our school nurses in New York State do not have access to the children's blood lead levels. This is not reinventing the wheel. We already have an infrastructure in place that school nurses can access to see all of the child's immunizations. It would be no big deal to add those EBLs to that same database. Parents are already signing off for the children's school nurses to share that same health information. It's no big deal to add lead into that. Teachers need to be aware that these children suffer from lead poisoning and that these children are not misbehaving. They cannot sit still. They just can't do it. This is a neurotoxin. These babies are moving in their seats. They're having a hard time concentrating, and they're often labeled as just a child who is disrupting the class.
Absolutely.
And their IEPs need to be specific to the lead poison. They're not going to be treated as your typical child with a learning disability.
Thank
It
you.
needs to be specific to that.
Thank you, Senator.
Thank you.
And I'll remind the folks at the top of the stairs there that sounds carry very much in this room, so your conversations in the room can be heard down here. Please take conversations outside. Senator Martucci.
Thank you, Chairman. So the first thing I'll say is thank you to this panel. Your perspective as parents on this issue is really important because I'm the father to 3 kids, 6 and under, and this is the stuff that keeps you up at night, right? The health and the safety of your kids. So first, thank you. My question is for Ms. Burton Hill. So we both call Orange County home. So first, I'll say great to hear that the Orange County Health Department and Cornerstone, which is an organization that does amazing work, was able to help you with your daughter. But one of the things that you talked about that I kind of wanted to ask your perspective on was with respect to proactive lead mediation. So I represent the cities of Port Jervis and Middletown in Orange County. I know you live in Newburgh, and all those cities share in common that there are a lot of housing stock, older housing stock, many of which are owner-occupied, homes that families have owned for generations. And you were saying that it can cost more than $10,000 to remediate lead pipes inside of a home. Do you think that there's additional benefit in us looking at ways that we can help homeowners or even small landlords, folks that might own one property in a community where they live, that they're renting, who just don't have the resources to address these issues themselves?
Well, actually, there was a program that homeowners were able to take advantage of, but there's also the issue of we're 70% renters. So a family could be in one place, I think someone mentioned it before, like how do we track the kids? So we want to be, you said proactive. So that's one way. Before a homeowner even purchases the home, there should be some lead policy in place. Then the upkeep and the maintenance of that home. Someone mentioned they get their car inspected once a year. Like, how do we do this? Who's going to pay for it? Especially, we're still in the middle of this pandemic. There's been a lot of loss of employment and the finances are not there, but money cannot be the reason we don't move forward. So I believe that there can be policies put in place to help homeowners secure that their home is lead safe, and also providing if it's not, because we don't want renters to start calling about, whether there's lead in the home, whether it's the water, the dust, the soil outside. My mom has this problem. My grandkids go over there, so I'm constantly trying to take precaution, right, to keep them safe. It's in our city, it's in our soil, it's in our country. Right? So at this point now, we have an opportunity to say, okay, this is where the emphasis needs to be in so many different areas. And proactive, there's many solutions, there's many ways we can do it, but definitely taking a serious approach is the way to go. I don't know, the funding is necessary to ensure the future of our children. And we don't know. I'm in a community, Newburgh. I don't have to tell anybody here, you pick up the paper. So I was wondering with this last incident that we had, of our babies shooting each other. Like, yeah, sure, there needs to be programs to help with their emotional well-being, but what about the lead that they have probably suffered that's gone undetected for a number of years? We don't know the neurological effects of this disease. There's not enough study that has been done on it to provide us with that information. So here we are with this bomb, and we're trying to deflate it, or whatever the word is, so that it doesn't explode and cause more harm. I don't know if I answered your question.
No, you did, and certainly your emotion is understandable. Anybody here that's a parent understands that our hearts are directly attached to our children's health and safety, and that's why I think we're all here today to listen to that, and I thank the chairs for putting this on today, because this is an important first step for sure. Thank you, Chairman.
Thank you, Senator. I will take one more time and say thank you, Ms. Jones, but thank you, Ms. Burton Hill, Mr. Kimmick, and Ms. Fair for sharing your experience and for being with us today. Since the other co-chair just came.
No, I'm good.
You have a question to ask. So thank you so much for sharing your experience, and I'm certainly hoping that this is the year, next year, that we actually get a lot of this stuff done. So we will be taking a 15-minute break for food and bathroom. So please do that. We shall be back in a little bit. Thank you. All right, we are back for the back end of this hearing on prevention of child lead poisoning. Next panel will be Sonal Jessel, Policy Coordinator for We Act. If I'm messing up that name, I apologize. And John Monahan, the President and Advocate for Monahan Consulting, LLC. And how is your name correctly pronounced, ma'am?
It's Sonal.
Sonal.
You got it right the first time.
Okay. And you could start at either one is fine.
All right. Well, good afternoon. Thank you very much, Chair Kavanaugh and Senator Rivera, for holding this hearing. And thank you to other senators for being here today. We really appreciate it. My name is Sonal Jessel. I'm the Director of Policy at We Act for Environmental Justice. We are a community-based organization based in Harlem and New York City. We've been around since 1988, and we particularly organize for healthy communities for low-income people and people of color, particularly in northern Manhattan, but have also expanded to do policy in the state, of course, and the city and the federal level as well. We are national leaders in environmental justice, and we particularly been working in lead for many decades as an organization. We worked very closely with now Senator Claire to enact Local Law 1 in 2004 in New York City with the New York City Coalition to End Lead Poisoning. And I'm here to talk about two specific things. One is the disparity in lead exposure, that it is primarily children of color and low income that are exposed to lead. This is a racial justice issue. And I'm also here to talk about some of the things that I like about what has changed in New York City and to start addressing the problem that can hopefully be helpful for addressing this statewide. So it's particularly Black and African American children that have the highest levels of lead, not only in the city, but in the state and also the United States. Second only to Latina children, and also Asian children, particularly South Asian children who have, according to my intern Jasmine, who found these numbers, that they have about 4 to 5 times the rate of lead poisoning in New York City, which was news to me. And I think that this is not only an issue of under-resourced, under-maintained housing in New York, but also, I'll bring up immigration as a barrier. If you have people living in New York City especially, basement apartments that are under-regulated, they're not getting inspected for lead at all. So this is definitely a multi-sectoral issue when we're talking about lead poisoning. The state is falling behind in protecting children of color from lead, and adults as well. The agencies tasked with lead poisoning prevention are working in silos. Municipalities, as we've talked about today, are very much working on their own. I do think there's a lot the state can learn around lead prevention from New York City's it's becoming a success, even though it's slow for the uptake. Particularly the Local Law 1, its turnover provision, that's what it is at its core, that regardless of whether or not a child is living in the unit, if there is someone moving out, a landlord must remediate that apartment for lead and must inspect it. Even though that hasn't really been happening enough in New York City, that law is really important. And with the increased enforcement that has been happening, especially lately, it's been able to be more effective, and it's a really strong provision. The idea is that over time, thousands of these apartments are remediated for lead, and we also know where lead exists in New York City, and this is something that could be done in New York State.
So, Ms. Jessel?
Yes.
Since your time is running out, I'm going to just
I'm
hold on
almost-
that. No, hold on. hold on that because I'll use my time at the beginning to give you an opportunity to finish that. But Mr. Mauer.
Okay.
Thank you. Thank you, Chair Rivera and Chair Kavanaugh and senators for holding the hearing today. My name is John Monaghan, and I've worked in childhood lead poisoning prevention in Utica, New York since 2016. From 2016 to 2020, I served as the Director of Strategic Initiatives, the Community Foundation of Herkimer and Oneida Counties on the Lead-Free MV initiative. And since 2020, I've worked as an independent consultant in this area. My testimony today will focus a bit on trying to understand the estimated size and scope of the problem, which I think will get to some of the questions that senators had for the first two panels. This is based off some fantastic research done at Columbia Law School under Emily Benfer. The 2019 Health Justice Advocacy Clinic there found that over 78.5% of New York's housing stock was built before 1980. So they estimate that there are approximately about 5.37 million occupied housing units in New York State that could contain lead-based paint hazards. And of that 5.37 million, 630,000 occupied units are estimated to have both children under the age of 6 and possible lead hazards. From that also, even though this is a challenging exercise to do because the data is, as we've discussed today, delayed and late. They had to use 2014 data in 2015. But based on that, they were able to then estimate that most likely somewhere between 80,000 and 100,000 children are likely to have elevated blood lead levels above the CDC's reference value. The 100,000 figure is the upper end of that estimate. They also took a look at what are the costs to society at large as a result of this. And I think it's important to note that these costs are costs that occur to children in one birth year cohort, so just children born between January 1st, December 31st, in terms of all of the expenses over their lifetime for this issue. And when they calculate that to try to figure that out, it came out to $904 million for every birth year cohort. Of that, about 106.8 million is a subset of that 900 million number, and that's just for children who are living in housing choice voucher supported units, formerly known as Section 8. So to give an idea of what this might include, it's about 790,000 in costs associated with the immediate medical intervention, 4.85 million for treatment of ADHD, 3 million to cover parental loss wages due to time taken off to care for a child with an elevated blood lead level, 2.2 million in costs associated with additional special education, and the whopper is $893 million in reduced earnings over a lifetime for that whole birth year cohort. And these occur every year that new children are born and age into the ages that we take a look at and are concerned. This increases every year. Taxpayers shoulder an estimated 26.72% of all these costs over that lifetime, which is about $241 million. And this is only looking at children who cross that threshold for 5 micrograms per deciliter. If you take a look at lower numbers, say at 2 micrograms per deciliter, the Altarum Institute has estimated, and you can see this at valueofleadprevention.org, that in New York State, the cost could be as high as $6.4 billion and impact 12% of all births.
A second. My time, please. So finish what you were saying there, because you were getting to some.
Sure. So those costs could be as high as $6.4 billion and affect 12% of all births. So if we've got maybe 4% of children at the 5% level, due to the earlier testimony today, we're talking when you get to lower levels closer to 0. That could be as high as 12% when you look at the 2 microgram per deciliter level. So it's an exponential increase in number of children affected and cost to the state. Thank you.
And Ms. Jessel, I'm sorry I cut you off earlier.
No problem.
You were about done, but I wanted to make sure that you could say it without having to run through it quickly. Go ahead. The
Thank
final
you.
part.
Yeah, I'll just highlight the 3 things that personally we're really excited to see that has been added to Local Law 1 that's helped make it stronger, that are general provisions that could be considered around the state and that we, are in many ways. The Department of Health has to inspect all units in a building where one child is found to have elevated lead poisoning in a unit in that building. So it triggers an inspection across the whole building if there's children in any of the other units. So that's a way of catching lead exposure before, maybe a child has an elevated lead level. It's a little bit more preventable. It's more on the prevention side, I mean. The second one is requiring inspections not only at a child's primary residence, but anywhere a child spends more than, I wrote 6 in here, but it's 10 hours a week. So that includes grandma's house, caretakers, child care centers, anything like that. And then the next is the expanded use of XRF devices for finding lead. And essentially, the more we use those, the more we use them in inspections that are triggered by a child that's poisoned, or inspections in a whole building or a multifamily home where there's exposure. We're kind of creating a citywide, or could be statewide, database of where all the lead exists in that area so that we can do prevention work. So those inspections are really important as well. So those are three things I wanted to specifically highlight. And that the point of sale legislation sponsored by Senator Kavanaugh is one really strong way to kind of do something close to Local Law 1, where we're saying you have to inspect and provide information about lead to the next buyer. And that's something that's really helpful, especially in New York State, where there's more, single-family households than in New York City in general. So those things I wanted to bring up, and I'll stop there. But those are really important. And then this also comes back to the need for that funding, where Bobby at the beginning of the day mentioned that $1 billion funding for this year.
All right. I just want to make sure that you had the ability to say it peacefully.
Thank you. I appreciate it.
You got off easy this time. Thank you so much both for being here.
Thank you.
And we have your testimony.
Thank you.
All right. Next panel will be Dr. Robert Amler from the New York Medical College Dean, from the New York State Network of Centers of Excellence in Children's Environmental Health, as well as Claire Barnett, Executive Director for the Healthy Schools Network.
Working on it. Thanks. I'm good. I appreciate it.
You may begin.
Thank you.
Is this mic on? Yes, it is. Good afternoon, Senators. Thank you for the privilege of being here. I'm Dr. Robert Amler, Vice President and Dean at New York Medical College. I am co-founder of NICECheck, the statewide network of children's environmental health centers specializing in environmental exposures to mercury, solvents, pesticides, and of course, lead. I'm also the former chief medical officer of CDC's Agency for Toxic Substances and Disease Registry and regional health administrator, U.S. Department of Health and Human Services. More than 30,000 children in New York have lead levels higher than CDC's new standard of 3.5. That puts them at greater risk than the majority, and these children are mostly from lower-income households in substandard housing. We cannot handle this with current resources. A substantial new investment is urgently needed in three key sectors to protect these children. One, our county health departments are already overtaxed and understaffed. They urgently need significantly more sanitarians and nurses and greatly expanded funding to ramp up home investigations for every child at risk. Locating the lead sources is labor-intensive and time-consuming and an impossible task without a substantial increase in trained personnel and funding. Two, private property owners urgently need a comprehensive support program to cover the expense for mandated cleanup, which requires skilled personnel and is often beyond average homeowners' ability to pay. Millions of New York families live in pre-1980 housing containing lead paint that remains a health threat until they can afford to get the lead out. But absent state support, most cleanups simply will not happen. Three, the network of children's environmental health centers will require an appropriate size grant supplement to manage the projected surge in children and families requiring medical evaluations and practical solutions to mitigate the risk of lead exposure. The centers also will fill a vital evaluation function as these programs progress and will document New York's progress, successes, and best practices for other states to emulate. Thank you for the privilege of speaking this afternoon. NICE stands ready to help find innovative solutions to mitigate lead exposure, and I will remain available to provide additional information if needed. Thank you.
Thank you, Dr. Amler. Okay. There you go. Go ahead, ma'am.
Great. Thank you. Good afternoon. My name is Claire Barnett. I'm Executive Director of the Healthy Schools Network. We were founded here in New York in 1995. My own activity dates to a little before that. I was on the State Board of Regents Advisory Committee on Environmental Health at School in 1993 and 1994, following my younger son's pesticide exposures in schools in 1990. Why are we talking here about the Department of Health and what health agencies can do and not the education agency? It's because the Regents and the Education Department have been absent on environmental health at school for many, many years. In fact, we have to thank Senator Rivera for his sponsorship and the unanimous passage of the 2021 law on lead in school drinking water. We hope it gets signed quickly. It would be a great idea for all the members of the committee to send a message to Governor Hochul how important this is. We hope that happens. So from the time the Regents addressed lead in environmental health in school back in 1994 and 5 to the first 2016 lead in school drinking water was 20 years, at least 20 years, 21 years. And now we have another effort to further reduce lead in drinking water, which is a good idea. So we have two recommendations on lead in drinking water. One is get it signed. The other for the Department of Health on lead sources is for the Department of Health to adopt the CDC new reference level. And that does require new funding for the Department of Health and the local health agencies. I also want to address lead, other sources of lead in school, because that was another thing that popped up in the Regents' activities. And they recommended that schools not import new sources of lead in school. That was back in 1995. There has been no action on that. It's 26 years. There has been no action on that. There is lead in synthetic turf, among many other things. I would recommend, in terms of lead in school supplies, because there's plenty of lead in school supplies, we seeded the New York State Green Procurement Program quite a few years ago under Governor Pataki, starting in 2005, and have supported the state's Green Procurement Program ever since. We have pitched to the co-chairs, DEC and OGS, that they take up lead-free purchasing specifications, number one, and number two, that they find a way to incorporate school purchasing into the Green Procurement Program. The Green Procurement Program not only eliminates certain hazardous chemicals in the products that the state is buying through the state agency procurement, but they also have shown year after year after year in their reports that they're saving money. I'm under the impression that schools have to save money, so they ought to be doing it. The last thing I want to talk about is really beefing up what New York State Department of Health should be doing for children. One of the things that we know is that state ed provides no oversight on the environmental health issues in schools. We also know the Department of Health is not providing any oversight on environmental health in schools. And we know that children in buildings that are falling apart have health and learning and thinking problems. That's not morally acceptable. We think, therefore, that first thing we want to have done is make sure that the Department of Health, which is currently planning statewide outreach through all the regions, 10 different regional meetings are being proposed, and they are going to exclude parents from that. That doesn't sound like a good plan. I think this committee could do a lot of good talking to the Department of Health, specifically to Gary Ginsburg's office, directing them to include parents and community members in that. Another piece of this is what's going to happen when you do find problems.
Give my time, please.
Thank you.
Go ahead, ma'am. Go ahead, no.
Thank you.
I switched it up to my time so that you can actually finish what you were saying.
I will. So the recommendation that goes with that is that when there are problems found, there should be a way to record them, and for DEC, State Ed, and Department of Health to be able to figure out how to handle that. They also ought to be able to have the authority to enter a school building without prior permission. Currently, no one, including the Federal Centers for Disease Control and Prevention, can enter a school building without prior permission. So how you will find lead in a school if you don't have permission to enter, I don't know. But anyway, I want to thank you so much for the hearing and for the opportunity to bring some issues to light. Thank you.
Two quick things. On that last point that you were making, so as far as being able to inspect schools without, let me know if you can hear me there,
I'm sorry, I didn't understand the question.
because I have not asked it yet. I wanted to make sure that you could hear me. Can you hear me?
Yes.
Very good. So on that last point that you were making regarding access to a school without permission,
Correct.
so tell me how, you said that the current standard is that you cannot do so without permission.
Correct.
How would getting permission change the
I think the
lead
agencies,
status in that school?
I think they need an authorization. That includes State Ed. State Ed itself and their staff cannot enter a school.
But you're saying that we should do away with that?
Needs a state authorization. I think it would require legislation.
But my point is, so tell me why you think that that is necessary, to be able to have access without permission, since it seems that if you're, unless there's a rash of schools saying, no, you can't come in to doing that type of inspection.
Well, there are, the challenge here is certainly the New York State Children's Environmental Health Centers know about it as well as our office does. There are persistent complaints about not being able to breathe the air in school, about flaking lead paint in school, about the drinking fountains have all been shut off and there's no free water and so forth. That kind of complaint is something that could be investigated if somebody could go in.
And do you find that in cases where they have to seek permission for access, that that's not done? I'm just trying to figure out the standard, which I was unaware of, but just quickly thinking about it, I'm supportive of the idea of not allowing access to a school without permission.
If there is a significant health and safety issue that has been raised through a complaint process, I
Okay.
think the agency should have the ability to go in and take a look at it without prior permission.
Gotcha. And then quickly on the issue of school supplies, so there is, what kind of school supplies have, in this day and age, still have lead in them?
Well, for example, in lead in drinking water, the so-called lead-free taps that EPA certifies still contain lead. Some of them have more lead than others. And so one of the things that the New York State Association of School Facility Directors has been able to do is share information internally throughout their members of which are the preferred faucets and taps that have less lead and don't seem to leach as much lead. So there's a problem there. And one of the things your bill, the 2021 bill corrects is this fallacy that there is such a thing as a lead-free school. There's plenty of lead in schools.
Right,
It's
but I'm-
not just old paint.
Right,
It's
but I'm
also
speaking-
some school supplies.
I gotcha,
PVC
but-
pipes, PVC contains lead, for example. Synthetic turf very often contains lead.
Gotcha. That's what I was looking for,
Right.
because I wasn't aware of, you're saying school
There are-
supplies as a newly acquired thing, because
Right.
there's at least the
They can
sense that
import it.
there is, that a lot of what we've talked about today has to do with how to get rid of what's already in the,
Yes.
whether it's in the
We
pipes
had
or in the
a,
walls, et cetera, but you're talking about newly purchased material.
Correct.
And how
New-
that could
new
contain lead.
purchases. Right.
And so there's potential legislation to say that that we should make not an effort, not just an effort, but that we should have a guarantee, I guess, from whomever's supplying whatever it is that we're purchasing on behalf of schools as a state.
Right. In order to do a major purchase, schools have to go through a purchasing specification and go out to bid, for example.
Yes.
Which is exactly what the state does on state contract.
Yes.
Schools both public and private schools and nonprofits and counties can buy off a state contract. So it would be of great utility and possibly great cost saving if you got, if it were possible to have lead-free procurement specifications within state contracts.
Gotcha.
And
Such a
that would
thing.
apply
and
to specific kinds of
Since my
things.
time has run out, I will ask just one question, please, yes or no. Is such a thing, would legislation be required for it, or could it be done just by regulation?
Green Procurement Council is on a governor's executive order and has been run that way for a long time.
I'm
so
just saying, as far as the procurement
I think
process, it would require legislation, yes or no?
The State Procurement Council was established under governor's executive order.
I'm
and still
talking about the
runs on that
procurement,
basis, but
since my time, the question is very specific. You talked about the procurement process and how it would benefit us greatly to have clarification of the procurement process as it relates to lead-free purchasing. Would such a thing be required to be done by legislation, or could it be done strictly by changing regulations?
It can be done through regulation, through
Okay.
existing regulation.
Thank
They
you.
could do that. Yes,
Good.
sorry, thank
No
you.
worries. Senator Mannion.
Thank you. This is a little bit off-topic, school-related, but it was brought up in previous testimony about school nurses having access to the lead tests, just like they would have access. I believe it was said that parents sign off on school nurses having access to the immunizations, and then also their lead tests as infants, for lack of a better word. Do you know of other states where that is? And again, I know your testimony is sort of in a different area, but I figured I'd ask that school question. Other states that allow school nurses to have access to.
I don't know that off the top of my
Okay.
head, but I can get back to you. We have the National Association of School Nurses is represented on my board, and I'd be happy to go back and ask about it. I know there has been a question about doing that in New York State. Would it be helpful, not helpful? Typically, it comes up in an IEP and 504 or IEP accommodation investigation when you look at all the sources. There was an effort at one point in New York here, several years ago, to assume that every child with an elevated blood lead level belonged in special education. And we did not support that because you really need to focus on what the child's capacities are as opposed to what the underlying medical liabilities might be.
Thank you, I appreciate that.
We also know that black and brown children once shunted into special education rarely escape. So it has to be thought out very carefully.
Thank you.
All right, thank you. Senator Kavanaugh.
Thank you. Thank you both for your testimony. This is for Dr. Amler. In your testimony, you talk about 30,000 children in New York State exceeding the current CDC level, which I guess is 3.5, is it microns? The health department testified previously that it's 8,000 that exceed 5, which is the current New York State standard, thanks to the good work of Senator Ryan and Senator Rivera. Is the difference between those two numbers just the difference between 3.5 or 5, or do you have some other methodology for estimating this? What's the basis for the?
Yeah, thank you for that question. When Dr. Ginsburg made that statement earlier this morning, I thought, gee, that's a discrepancy from what I'm about to say. I went back and double-checked my numbers, and I'll stand by them. I was basing them on the statistical fact that the 3.5 level is based on the 2017-2018 NHANES National Survey of children and adults on all kinds of health parameters, including blood lead. A certain statistical sample of American adults and children are tested for blood lead, and the CDC standard is defined now as 2 standard deviations above the mean, which means, by definition, 2.5% of that population. Taking 2.5% of the estimated recent census data on children 1 to 5 in New York State, 2.5% of that number is 30,000. Actually, doing my statistics, I only had ages 1 to 4, because of the way things, sometimes 5 to 9, you don't know which ones. So when it's 1 to 4, the number was 28,000. So I did adjust that figure slightly upward by less than 10% to accommodate the 5-year-old. So that's where I get 30,000. Now that's children 1 to 5. Many times in national studies, of which I've been part many, many times, we will look at all children in the United States, which we take as the under 18 population, because older children, school-age children, adolescents are still growing and developing, and depending on certain toxicants, they are more susceptible than the fully grown adults, the so-called marine recruits who are healthy and fully developed and so forth. When we take the population up to 18 in New York, we actually end up with 100,000 children under 18, and I realize some of them are strapping 17-year-olds, so it's not all the same, but 100,000 are in that upper 2.5%. I have to emphasize that the level of 3.5 micrograms is not down adjusted by CDC because of a particular evidence of health effects, which to me as a clinician is one of the gold standards that I would look to. But CDC for the last several years has used the 2 standard deviations. It's a statistical thing saying you are clearly above all the others. You're above 97.5% of the other people in your population for blood lead. And they take that as a serious indicator that lead exposure is higher than it should be.
So that's, so effective, just if I can sort of put this into my language of more limited understanding, the CDC itself is effectively using 2 different standards. They've used the 3.5 as a benchmark that requires particular actions when that level is found. But if we want to assess the extent to which children are being affected, you're saying this method where it's 2 standard deviations above is also a method that CDC recognizes.
Yeah.
And based on that method, you get 30,000 in that age cohort.
Again, an excellent question. And a distinction that I think has not been made very clear. When CDC lowered the standard last May, we were all in the middle of a pandemic. A lot of the public health issuances got far less attention than they usually do. I worked at the CDC for more than 25 years. I know how they operate. But really, since about 2010, 2012, CDC has downshifted the reference level, not an action level, but a reference level for blood lead based on the statistical model. And the reason that has come down is simply that blood lead levels across the country have come down. In a sense, there will always be 2.5% that are higher than the other 97.5%. So, but that was the judgment that they have made, and actually they've used that even with the cutoff of 5, which was done, as you may know, in 2012. New York State did not drop down to 5, stayed at 15 for quite some time. So there are discrepancies there. We all agree on the outcome, which is less lead in our bodies, healthier children, and healthier adults too.
Thank you, Doctor.
But how we measure is also a methodologic issue.
Thank you, Doctor.
Thank you.
Senator Martucci.
Thank you, Chairman. Ms. Burnett, I just wanted to see if you could help clarify a statement that you made with respect to the DOH allowing parents at these regional planning meetings that they have. Could you share a little bit about that and just kind of like, because this is the first time that I'm hearing this, and certainly if I've learned one thing from today, it's that parents having a voice in this process is absolutely critical. And that's certainly not lost on me. So can you please elaborate?
Yes, I'll be happy to. I'm not quite sure why the decision was made that way. New York State Department of Health has an informal advisory committee. We're one member out of, 30 or so individuals. It has been called the Clean, Green, Healthy Schools Advisory Committee. It was begun on a small EPA grant about 10 years ago. And currently they're planning to do a statewide outreach program that would begin in the spring. That would target regional meetings for school leaders, superintendents and principals and probably some board members, specifically on the rules and regulations around environmental health at school, and probably some best practices recommended by EPA, which has been working on school environments for a very long time. And so we were very interested. It sounds great. How can we participate? Can we activate people and get them to, you know, those sessions and so forth? And it has been clear from the office that parents are excluded, and community members are excluded. Well, those are the voters who are going to vote on the budget, you know. So it didn't make a whole lot of sense. It really doesn't make a lot of sense, knowing that neither the state ed department nor DOH speaks to parents about these issues.
Well, I share your concern with respect to that, and certainly I think the
Doesn't
parents,
make any sense.
Yeah, parents and the community need to have input in this process. I got about 1 minute left, so Dr. Amler, I have a quick question for you as well. Sure. Looking through your proposals, I love the second proposal with respect to private property owners, and I'm a big fan of not only providing state support to these property owners who can't afford these cleanups themselves, but also using our tax code to incentivize homeowners in ways that will help them have the ability to do this. Sort of like on an average, back of the napkin number, what do you think the average cleanup looks like? Do you have a cost associated with that to the average family?
I don't have that information. I'm sorry. I don't have that information. But in some homes that I've investigated myself, the lead is insidious. It's all over. It's in the paint. That's the primary. We've all heard that this morning and this afternoon. And fixing that is going to be a lot of money. My concern is that too many homeowners who may be called, responsible parties, one of the other witnesses may use that term, responsible party. Well, responsible party, they're responsible parents. They want their children to be okay. But if the law says, well, you're the responsible party, this is your problem, it's not going to happen because they won't be able to finance this. And I'm concerned, frankly, about small and mid-sized landlords as well, because they're only so far away from the homeowners themselves. It's still a big expense, and if we impose that, I'm not an expert on public policy, but my concern is that if we impose that, there'll be too great an incentive to not comply, and then the job simply will not get done.
Thank you, Doctor.
Thanks, Doctor.
Thank you, sir. All right, so, I will give you 30 seconds, madam. Go ahead.
Just one comment. The question was, where is lead in school and so forth? To Rob's point about lead paint abatement, there is a regulation within New York State Education Department about regulating flaking paint in schools. But one of the things that is the most dangerous time on that issue is school renovation and construction. So schools have a very short window of opportunity in the summer to do whatever they need to do to modify or alter or renovate. Typically, they begin while school is still in session, so there's demolition taking place while children are still in the building. So it's really important to have a lot of information out to the parent community. Thank you.
Thank you, ma'am. And thank you both for being here today. Moving to our last but certainly not least panel. That will be Josh Kleinberg, External Relations for the New York Legal Conservation Voters, Liz Moran, New York Policy Advocate for Earth Justice, and Rob Hayes, Director of Clean Water for Environmental Advocates, New York. And as you're coming down, I will take a moment to point to the lady immediately behind me. This is Mary Starace, who is my, yes, give her a hand, please. Give her a hand. Yes. She was a legislative assistant, and she put this hearing together, and she hit it out of the park. So I just want to make sure that I shouted her out, which she was right behind me. So you may start at any time, folks.
Okay, is my microphone on?
Indeed.
We are panel number 9. We are so grateful to be here. Thank you for waiting it out. Good afternoon. My name is Joshua Kleinberg, and I'm the Senior Vice President at New York League of Conservation Voters. New York LCV is a longtime member of the New York City Coalition to End Lead Poisoning and a steering committee member of Lead Free Kids New York. I want to thank Chairs Rivera, Kavanaugh, and members of the Senate for the opportunity today. Earlier this year, New York LCB released a report. 5 is the new 15, which made recommendations on how New York has become the biggest state in the nation with the most protective health standard for public school drinking water. Thanks to Senator Rivera and the entire state legislature, we are closer than ever to having a law that will strengthen the 2016 Safe School Drinking Water Act by reducing the lead action level from 15 parts per billion to 5, which brings us even closer to the American Academy of Pediatrics recommendations of less than 1 part per billion. We sincerely hope that Governor Hochul signs this bill and into law very soon so she can protect more students and staff from lead exposure in their drinking water. But New York State now needs to turn its attention to lead service line removal with urgency. There are at least 360,000 lead pipes statewide, with 137,000 of them in New York City alone, delivering drinking water to smaller, older homes. The total cost to replace lead service lines in New York State ranges from $1.8 billion to $3.6 billion. The reason why we don't have a clearer idea of the size, scope, or cost of the problem is that we do not have a public, centralized inventory of how many lead pipes are out there and where they're located. As the Department of Health acknowledges in a 2019 publication, quote, "A major obstacle replacing lead service lines is knowing their location." And they go on to say, to overcome this obstacle, the first step of would be a statewide lead service line creation of an inventory, end quote. I mangled the quote, but that's what they say. We believe that getting this data and visualizing it will be the key to unlocking the existing state and incoming federal funds earmarked for getting lead pipes out of the ground. So having a centralized public database in a timely fashion, however, may require swift action and support by the state legislature. The data should be easy to come by, as the adopted 2019-20 budget added provision public health law, which requires the water companies to provide their customers with that information, although they should be, at least, general information regarding the lead pipes reasonably known within their system. And while this requirement has been on the books for 2 years now, I'll say it again, this information is neither easily accessible or available and centralized in a public database. So we're urging the legislature to work with us and advocates to come up with a plan so we can ensure that this becomes publicly available in a timely fashion so we can then craft a program to remove the lead service lines just as effectively as we all work together on reducing lead in school drinking water. That's all I have to say. And if any of the New York City senators were interested in how many lead service lines were in their district, I have that information. I'll be happy to share with you if you want to ask me about it. And my apologies to Senators Mannion and Ryan and Martucci. No offense to you, but as I said, this information is neither publicly available or easily accessible and centrally located. If I had it, I'd show it and I'd be able to tell you about it. But maybe in the future we can get there. Thank you.
Oh, wonderful. Thank you all for the opportunity to testify today. My name is Rob Hayes. I'm the Director of Clean Water for Environmental Advocates New York. We're a statewide advocacy organization based here in Albany and committing to protected public health and furthering environmental justice. I'll be speaking today, like Josh, about the dangers posed by lead in drinking water and the state-level policies that we need to expedite the replacement of each and every lead service line in New York State. You know, no New Yorker should have to worry that the water coming out of their tap is safe to drink. Yet, as my colleague noted, an estimated 360,000 of these dangerous water pipes are still delivering water to homes across the state. And this is almost certainly an underestimate, as my written testimony goes into. Because these pipes are more common in older housing stock built before 1945, low-income communities and communities of color are facing disproportionate exposure to lead in their drinking water. Now, water crises across the country, and particularly in Flint, Michigan, and Newark, New Jersey, really show that we cannot wait any longer to dig lead pipes out of the ground. Lead service lines should be replaced before people get sick and not afterwards. Our nation has been regulating lead in drinking water since 1991, yet in the last 30 years, extremely little has been done to eliminate this source of contamination itself. But now, New York has a once-in-a-generation opportunity to get the lead out of drinking water. Thanks to the passage of the bipartisan infrastructure bill, our state is about to receive an unprecedented amount of investment, possibly over $500 million from the federal government to remove lead service lines. This is the perfect time now for New York State to put in place the policies that will start us down the path towards 100% lead service line replacement. So what has to be done then? Definitely want to echo what my colleague just said about the importance of lead service line inventories. That will make the process so much easier as water utilities are figuring out which pipes they need to replace. We also need to make sure that every single lead service line replacement that happens in New York is conducted as efficiently as possible, as equitably as possible, and that homeowners are not on the hook for these costs. Financially struggling New Yorkers, people who are already struggling to pay their bills, should not have to pay several $1,000s to remove a threat to their drinking water that they didn't even put in the ground in the first place. And finally, the last thing to note before my time runs out is that as monumental as the $500 million or more we might be getting from the federal government is, it won't be enough to replace every single lead service line in New York State. And to get there, that's going to require continued investment from the state in terms of grant funding to make sure that local governments have the resources that they need to address this problem and make sure that everyone has lead-free drinking water going forward. So thank you for your time.
Good afternoon. My name is Liz Moran, and I'm the New York Policy Advocate for Earth Justice. Earth Justice is a national nonprofit law firm that's fighting in the interest of the public to protect air, water, and natural resources. So thank you for the opportunity to testify today on policies the state should pursue to prevent lead exposure. Eliminating lead exposure is a top priority for Earth Justice and our partners and clients, and we offer a number of resources on this topic, including our online tool, betterleadpolicy.org. It provides a number of resources about what states and local governments can do to prevent lead exposure and what policies they can adopt. We provide a lot more information in our written testimony, so I'm summarizing that here today. As you heard from so many people, it's widely understood that any level of lead in the body is linked to health harm, including neurological damage in children that is irreversible, increased risk for cardiovascular disease in adults, and likely cancer, which makes it crucial to eliminate all possible routes of exposure to lead. These harms, as many have noted today, disproportionately fall on low-income communities and communities of color, and the lead crisis is particularly acute in New York. Relative to other states, New York has the greatest number, 3.4 million, and the highest percentage, 40.9% of its housing stock, built before 1950, making New York housing particularly likely to contain deteriorating lead paint. Additionally, it's estimated that New York has at least, if not more, 360,000 lead service lines for water distribution, posing another route of lead exposure. Public health experts have identified that replacing lead service lines is the most important effort that can be undertaken to reduce lead levels in drinking water. This route of exposure is often overlooked, but it can be significant. Formula-fed infants can receive most of their lead exposure from drinking water used in the formula. Unfortunately, the federal government has dropped the ball when it comes to preventing lead exposure and educating public. So to protect the health of New Yorkers, it's imperative for New York State to take a leadership role in preventing lead exposure. So to that end, Earth Justice urges the legislature to address the following, which we detail further in our testimony. We urge for the passage of Senate Bill 2142A, Senator Kavanaugh's legislation, that would require the disclosure of lead-based paint test reports in real estate transactions. We urge for the passage of Senate Bill 3079 by Senator Ryan, which would prohibit the exclusion of insurance coverage for losses or damages caused by exposure to lead-based paint. We also urge for the passage of Senate Bill 6554. We also are advocating for increased lead service line replacement grant funding in this year's state budget and for the equitable distribution of the federal bipartisan infrastructure deal funding to deal with lead service line replacements, and like our colleague said, for more inventory reporting and data on lead service lines. Thank you so much.
Thank you all. Senator Ryan.
Thanks so much for your testimony today and your advocacy around lead in general, so thank you on that. Could you explain a little bit about the lead pipe issue? I'm more familiar with the paint. Are we talking about the pipe that sort of goes in the middle of your road, and then from there you have leaders that go off to your house, then from the leaders you have another pipe that goes right to your meter and then through your house? So where in that process are the pipes lead, or the fittings lead, or the solders lead?
And I'm happy to kick off the answer to that. The greatest contributor to lead in drinking water are going to be these lead service lines. So the service line is the pipe that runs between the water main running under the city street and the internal plumbing in your home. So that length of pipe right there.
Yep.
Luckily, most water mains, the pipes that are running under the streets, are not contaminated with lead, just generally because of the softness, the malleability of the material. With so much water rushing through it, it just wasn't feasible back when a lot of these mains were installed. So luckily, water mains themselves don't have lead in them. So we're concerned about the service line, and that's the full length of the service line from the water main all the way to the home. There is also potentially some lead fixtures that could be in the home itself that could be contributing to lead in drinking water, but that's generally considered to be a smaller proportion that they contribute, and certainly a much bigger task to kind of go into every home, figure out what those fixtures are, and replace them.
So in most municipalities, that leader is owned by the homeowner. I only know this because I had the misfortune of having to replace mine one day. So, they'll tell you that's your business. So generally, how would you think of if we wanted to replace those? Like, how do you measure, how do you prioritize of every lead leader in New York State, which ones to replace?
And I'm happy to start with that as well. Certainly, one, we do want to make sure that, of course, when the pipe is privately owned, that it still gets replaced. Every single lead service line has to be replaced. And that cost should not fall on the private homeowner if they own that pipe. We're facing such a scale of this problem. It is so enormous that it has to be a problem that's solved with state resources, with federal resources, because many low-income homeowners just can't afford those costs. In terms of who should kind of be prioritized as we're conducting these replacements, with this federal funding coming in, whose pipes should get dug up first? We really believe that the communities that have been most harmed by the lead poisoning crisis are where water utilities should be focusing their efforts to conduct replacements. In the low-income communities, in communities of color, where we already see high levels of kids with elevated blood lead levels. These should be the homes that are having their pipes dug up first so we can start to eliminate that exposure that they're facing.
Thank you.
And just two quick points, and Rob said everything terrifically. Just two things I just wanted to leave you with as well. Again, lead is rarely found at the source water. It is rarely found when it leaves a pollution control plant. It is rarely found, if ever, when it's going to the water main. It's really that last mile sort of thing. So it's either the lead service line in smaller and older homes and within schools. It's within the building itself, the fixtures, the pipes, et cetera. The second thing to add on to his response to your second part of the question was the Department of Health has blood lead level, median household income, and housing built before 1939 as their criteria for looking at it, but as Rob's suggesting, there might be other things to look at as well.
Thank you. Senator Mannion.
Thank you, everybody, for your testimony. This is not probably a legislative item, but one of the articles where you referenced, Mr. Hayes, spoke of a snake-through method, a pull-through method of copper piping, and the feasibility of that being done and the cost savings that might occur with it. Any of you could speak on that if you like.
Yeah, I can touch on that a little. There are various ways that water utilities can go about replacing lead pipes. The method that you were mentioning, I think, is where a kind of small hole is dug where the pipe, say, enters the water main. And at that point, you can kind of pull the pipe out through that hole. It means you don't have to dig up the street. It's so much cheaper than actually digging up the whole kind of trench where the service line is. That's absolutely the approach that we hope most water utilities will take. And it can dramatically reduce the cost of these replacements. I know in cities that have done that, I think Lansing, Michigan is one, they got their lead service line replacement costs per pipe replaced down to about $3,600. Oftentimes the cost might range between $5,000 to $10,000. So doing a method like that means we're just getting to dig more pipes out of the ground.
Thank you.
Senator Kavanaugh.
Thank you. As I mentioned earlier, I had the opportunity to stand with Senator Schumer announcing this very generous new source of funding on replacing these lines. And we talked about making sure that the state does what we can to accelerate the process, make sure that this money gets spent quickly. What do we need to do? I mean, recognizing that there's incomplete information about what's out there and maybe not the full data that we would desire to properly prioritize these projects. but also just recognizing an urgency every day that one of these things is in place. It is likely exposing people to lead. What do we need to do as a state to make sure that this program rolls out quickly and effectively?
I would say very quickly, let's get that inventory. You cannot manage what you cannot measure. And the quicker you have that information, you'll know the size, the scope, and location. And then number two, immediately on the heels of that or concurrently, set the criteria about how you spend the money wisely. There is existing state money, there is incoming federal money. It won't necessarily cover the 3 to 4 or 5 billion, whatever it might be, but learn how to spend that money wisely and quickly. But having that information first and knowing where you're going for is key and essential. Otherwise, you might learn too late or after the fact that you should have been going elsewhere sooner.
And how is that data? How would one, I mean, in New York, you have this program where people can order a free lead test and get it sent to them and test and have their water tested in their home.
Yeah.
Yes, and there's.
So New York City, so we have this information. I have a handy little map here, which I can show you offline. And, New York City Council, and advocates worked with the council several years ago on 25 bills. One of the bills was the legislative body compelling the executive authority agency to put together an inventory. And so that's what the council did. They passed legislation in 2019. New York City DEP put out the data, and now we're able to map it. And we're able to map it by all sorts of characteristics, by political jurisdiction, by block, by property, and we have that information. If we had that level, if we had that on a statewide basis, basically a legislature, say, compelling an executive authority to collect this information from water authorities that have this information or should be having this information already, we can get there very quickly, but there needs to be a spark to push it along.
Is it your belief that in most instances the local water authority knows where these pipes are, and it's just a matter of effectively gathering data that's already in the possession of various water authorities and sort of aggregating it and then mapping it?
Whatever they know, they should be already disclosing to their customers on the annual water statement. Clearly, whatever they don't know, there needs to be a myriad of efforts that could be made. City of Troy, for instance, is voluntarily asking its citizenry to, look at the water line in your house and do a scratch test and find out, what it is and help report that to the city. There are any number of ways that we can get that information. In the city of New York, about 25% of the service lines are unknown. They just don't know. And that's probably going to be true around the state. But until we have that baseline, then we can kind of go after what we don't know. But clearly, what we do know, we should start to prioritize and fix.
Great. And just any other thoughts on this?
I'll just mention really quickly, to your question about how should New York be rolling out this money and what can we do immediately. We've been collaborating with a partner who unfortunately wasn't able to be here today about putting together kind of what are the principles, the best practices for lead service line replacement. What are the specific policies New York should be adopting so that when we get this money, we can hit the ground running and start doing replacements as equitably and efficiently as possible. That's something we can definitely follow up with the committee on.
And just, sorry, you said you're collaborating with a party that's not here today. Who is that?
That would be Joan Matthews from the Natural Resources Defense Council. And I think she has testimony submitted to the committee as well.
I think so as well.
Yeah.
Yes. Okay. Anything else? Okay. Good.
No,
Yeah, no,
I'm fine. Thank you.
Good. Okay.
Thank you.
Thank you.
Senator Martucci.
Thank you, Chair. So, Mr. Kleinberg, I'm sure you recall, it seems like forever ago, right, when this hearing started, but one of my first questions to DOH was about that annual water supply statement. And I think you heard their answer, which was, well, we have a lot of them in the system, right? And I know that I represent areas where my constituents can't find anything out about their drinking water because they have to call my office and say, how do I get a copy of this? They might call the mayor. It might be from a village water system. I even represent areas that have private water supply systems that just serve a couple hundred homes. And, DOH said that they'd made strides in this respect to get some of them in the system, some of the bigger ones in the system. But again, I think of areas that I represent, like the town of Wallkill and the village of Florida, where it's hard for people to get information. And I feel like if it was all in one place, everyone would be much better served in terms of getting information about their water. So certainly, I just sort of want to say I applaud you for your efforts, and I look forward to joining you and putting pressure on DOH to finally do that, because the bottom line is it should be happening already. Frankly, it's not that difficult to do because these water suppliers are are producing these reports.
Yeah,
it's just a matter of finding them.
I greatly appreciate that. Again, the information is neither easily available, centrally located, and unlike the lead in school drinking water scenario where all the lab, we're able to get 80, 90% of all the different lab reports, that information was easily accessible, and then you can make a decision, come up with the data, do the modeling. we're not even close to being there on the lead service line. So I applaud you for bringing that up, because having that access to that data really helps to make good decisions, and that's really what this should be all about.
Excellent. And thank you all for your testimony today.
All right. As we are coming to an end here, thank you all for your testimony this afternoon. A couple of last comments and then some housekeeping, and then we shall be done. And you folks can certainly go back to your seat. On the housekeeping thing, just real quickly, anybody who is hungry, this is not a joke, we got fresh sandwiches that were made today. We have quite a few of them left over. So if you're either in this room physically, or you can hear my voice and can walk over there, like people at home, don't run here because they're going to run out. But Donna and the rest of the folks that are back there doing some of the video stuff, we're going to hold some sandwiches for you. Definitely can come and get those before we're done. That was serious, by the way. But so we heard a lot today. There's a couple of things that stuck with me. Number one, that we keep getting reminded that it was 50 years ago that we kind of started this trip, and some folks have been advocating for that long. And we also heard that we cannot possibly continue with a standard. Somebody said this, and it stuck with me. We have currently a standard which basically uses children as test strips. I don't know who said it, but it stuck with me, because it's particularly egregious. That is the reality. We also heard that there's a lot of hope and hope for the possibilities of this coming year, since we had the departed administration, which failed us in so many different ways. We just heard another set of those ways today. But we're certainly hopeful that this new administration will recognize the responsibility that we have as a state to families and children all over the state, and actually get some of these bills passed, but most importantly, put some actual money in so that we can resolve the issues for the long term. We heard about particularly the testing in homes and apartments, in buildings. It is obviously something that we need to get done right, because if we don't, it is just going to linger, particularly since it was pointed out by Senator Ryan, the places where the highest rates are just going to continue to be the places where the highest rates are. Less of home ownership, which means that one person goes and rents to the other one, rents to the other one, rents to the other one, and then people just get hurt over generations. So I would say that I'm thankful for everyone that had something to add to the conversation today, and like you, I am certainly hopeful that this coming year will be one where we can actually get some real money and some real commitments into making sure that we can solve this for the long term. Thank you all for being here today, but Senator Kavanaugh.
Yeah, I'll be brief, just to, again, thank our co-chair, Senator Rivera, and all of the senators who participated today. I also just want to add my thanks to my staff, Dan Mosher, who's here, and Kate Ember in the back, and Hallie Chu, who's our Housing Committee Director, and also the central staff of both of the committees and the Senate Majority Policy and Research operation that put together a lot of the background materials today and did a lot of the preparation. When you talk about this problem as being among the most prevalent preventable environmental health problems that we face, I think it really is important to just focus on the fact that it's preventable now, and it's been preventable for a long time, and it is long overdue, as we've heard today from many of the people who testified. It's long overdue that we address this, that we end lead poisoning, that we make our homes lead-free, and eliminate all these paths to exposure. So I'm very committed to that. I know many of my colleagues are committed to that. There's going to be some complicated questions about what the standards are, who's responsible for them, how to pay for all of this. But I join many people who have spoken today in committing to getting this done this session. Thank you very much.
Thank you so much, folks, and that brings our hearing to an end. Come get your sandwiches. Thank you.